We need to ask all of the supervisors who may not have heard me earlier to refresh the browser on their agenda software application.
Ready?
Okay.
You giving me the thumbs up for the 3, 2, 1?
3, 2, 1.
3, 2, 1, let's go.
All right, excellent. All right, it's 9 a.m. We're going to go ahead and call the August 4th, 2020 Lake County Board of Supervisors meeting to order. I want to welcome everybody. We're going to go ahead and start as usual with a moment of silence. Do we have any dedications of moment of silence today? For the board, we'll stand for a moment of silence. EJ, do you have your hand up?
Oh. I was on mute, but I had one.
Okay, go ahead.
Yes, I'd like to have a moment of silence for Wilbur Augustine of Upper Lake, California. He was a veteran of the Korean War. He was in the 1st Cav. He was a leader for Robinson Rancheria tribe during the revocation of termination and brought back Robinson Rancheria back in the 80s. He and other council members worked with the county to establish what is now Robinson Rancheria. Before he retired, he worked for Northern Circle. During my adolescence, he was one of the main families that were there at the Upper Lake High School games, and he'll be greatly missed.
Would you lead us in the Pledge of Allegiance, please, Supervisor Crandall?
Yes. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, are there any extra agenda items? Are there any extra items not appearing on the posted agenda? I don't think so, but I'm just going to ask.
I have none, Mr. Chair.
Thank you very much. Yes.
Mr.
Okay, moving right along to our number 5, approval of consent agenda. And I think informed earlier there will be, are there any items that need to be removed from the agenda?
Mr. Chair,
Yes.
I'd like to pull item 6.5 from the agenda for a later date.
Okay, are there any other agenda items that need to be pulled? Supervisor Sabatier?
Yes, I would like to pull consent agenda item
Go ahead, Supervisor
5.2.
Sabatier. Can't hear you.
Oh, check, hello? Can you hear me now?
Supervisor Sabatier?
Hello.
He had his audio earlier.
5-2. 5-2.
We're waiting for staff to correct that. Could I advise you that I'm requesting to pull 5.1. There was a minor error in the documents that we need to correct before you approve.
Okay. And I know Supervisor Sabatier wants to pull an item, so.
Can you hear me? Hello?
Jake and Sam,
Check.
can you tell us what's happening with their audio in the boardroom?
Yeah, that Zoom participant's muted. I'm having him check it out right now.
Okay, and I'm also being advised there is no audio on Granicus.
All right, I'd just like to say to the public and everyone, all the constituents on the line, please bear with us while we figure out these technical difficulties. I know we're working through it right now and should be resolved momentarily.
Okay, we are getting audio.
6.5?
So,
So we're going to go ahead and take
Moke, can you hear me?
we're going to take a 5-minute break.
Can you hear me, Moke?
And we'll return at 9:09 with the
Yeah,
follow.
to return at 9:09. Hopefully we'll have the technical difficulties figured out at that point.
Okay. I'm going to call him.
Okay, Jay, can you hear me? Jake, you cannot hear me? Okay, Jake, can you hear me now? Okay, Jake, can you hear me now?
Yes, we can hear you now.
Okay, so we got muted.
The title shifted and I accidentally muted you guys.
Aha, that's what happened. Okay.
We still need to check Granicus audio.
Yeah, I'm checking that now.
Okay.
I'm curious. Oh, I have an idea of how that happened. Yeah.
So, Mr. Chair,
Are you guys asking about public comment?
I don't believe the public could hear the initial,
The initial announcement?
yeah, of the pulling of agenda items. Yes, so.
Okay, so we'll go ahead and restate and start again then,
Thank you.
when we get going here.
Public comment for each agenda item, you can come to the microphone, you have to wait for Mo to say he's coming to the room. Once you're done, if you could just grab a wipe and just kind of wipe whatever it is that you touch, and sit back down, that way.
Okay, we just have Supervisor Sabatier giving some instruction to the community members that are in the room.
Which means that maybe there'll be the allowance of public comment, I don't know, I think that'll be up to Mo.
So let's prepare to restart. We're about a minute and a half away from 9:09. Let's hit it.
Yes.
At 9 o'clock sharp, 9:09 sharp.
Okay, we are ready.
Okay, Mo, when the clock ticks 9:09, you're good.
Can you hear me?
Yes.
Ah, much better.
I have 9:09.
Okay, we're going to go ahead and reconvene the meeting. I want to thank you for working with us through the technical difficulties. Thank you for getting that fixed. We're going to go ahead and reiterate where we're on. We're on item number 5 on the agenda, and it was requested for items to be pulled. At this point, we have 2 items that have been pulled, and I know we have one more. So we have item 5.1. Item 5.1 has been pulled from the agenda to be talked about here today. And also, item 6.5 has been pulled from the agenda by Supervisor Crandall, and that will not be readdressed today. And Supervisor Sabatier, you had your hand up to pull an item. Go ahead.
I have a question that comes from the public, and also I would like to ask to pull item 5.2 for further,
Yes, that's
for
what we're
further
doing.
discussion.
We're pulling item 5.2.
And so the question from the public is, if we are pulling item 6.5, can they come up to public comment to state to express themselves on that topic since it is no longer on the agenda? Or what's your thoughts on that?
Very good question. Anita,
Yes, sir.
I put forward that question to yourself on this one.
All right. Well, first I'd note that right now you're dealing with the consent agenda, so it's only the 5-point items that are being considered. But with regard to an item that your board is pulling from the agenda, it's not being taken up at all. Now, the public could comment on that act, the desire to pull it, if they wanted to do that. But substantively, the item won't be taken up, and your board has to be careful. You can't say, well, we're not taking it up, but everybody come and talk about it. So, in fairness to all the public, you don't take it up substantively, but if members of the public want to talk about the idea that the item is being pulled, then yes, they are entitled to comment on that.
Okay, thank you for that clarification.
Mr. Chair, I apologize for interrupting, but apparently we still do not have audio on Granicus. So I need to ask Sam, are we aware that we still have an issue?
Yes, I think what we're going to need to do is to restart Granicus because everything is feeding it.
Okay, I'm really sorry, Mr. Chair, but we're going to need to take another break. Sam, how much time do we need?
Oh, it's all being fed. We just need to stop it and restart it.
Do we need another 5-minute break?
Sure. Yes, 5 minutes. Sure.
Okay, we're going to go ahead and take another 5-minute break while we figure out Granicus. I want to thank the public for being patient with us while we work through these technical difficulties. And we will reconvene at 9:15.
To get Granicus up and running, or shall we proceed without it?
I'm not
Okay,
sure.
so is Granicus restarted?
Sam, did you just say Granicus has started?
Yeah, no, I'm not. I'm asking.
Yes, Johanna restarted Granicus, but we still have no sound.
Okay.
Yeah, so I'm trying to check the server for any issues.
Okay, so we have audio on everything, and it should return to Granicus now. If Granicus is working.
Bruno, can you, sometimes you test Granicus for audio. Are you able to do that?
Yeah, I'm checking it now.
Can you hear me?
Yes, Bruno.
Okay, let me go check that out real quick.
Thank you.
So it's definitely in progress. Let me check for sound. Check, check. Hello, hello.
Yeah, we can hear you.
But we're trying to see if he can hear himself in Granicus.
Check, check. Hello, hello. I'm waiting to see Moke's lips move to say that he can hear me.
Yeah, we can hear you.
No, but it's got that delay, and I still haven't seen your lips move.
Oh, yeah. Still nothing, huh?
Yeah, nope. I saw your lips move, and there's still nothing.
Okay.
All right, so Jake, I need a recommendation. Are we going to be able to get Granicus running, or should we just move on and use Zoom and Facebook, which are both fine?
I'm guessing Facebook is probably silent too.
On the server. I'm just logging into it now.
Okay, we're being recorded, and there's audio and
So just make one more announcement. If anyone's on Zoom or Facebook at this time, we are having difficulties with Granicus, and we're trying to work through that. We'll be starting here momentarily, but we appreciate your patience as we work through these technical difficulties.
I'm guessing Facebook is probably. Oh no, Facebook does have sound.
On the server.
And I want to say the majority of folks are either on Zoom or Facebook. Probably not all that many on Granicus while it's live, but that's just my guess.
I would agree with that.
Okay, so what we could do is go ahead with the meeting and just load this recording onto Granicus afterwards, if that's acceptable. Because
Yes,
everything else is
that's
getting.
acceptable, and I want to ask Matthew Rothstein to put out a public advisory to redirect folks from Granicus to Facebook or Zoom, and advise also that the recording of the meeting will be put up on Granicus later, so we can restart now.
Question on restarting. Are we going to restart the entire meeting? Or just move forward because we're on Facebook and Zoom?
Well, if Granicus isn't reloaded, why would you have to restart?
Yeah, you don't need to restart.
All right.
Because this video that we've been taking is complete.
Okay. All right then. So we got 3, 2, 1. We're ready to go?
We're ready to go. 3, 2, 1. Let's do it.
Okay. All right, we're going to go ahead and reconvene the meeting at Lake County Board of Supervisors meeting at 9:23 is what I have. We are on item 5, which is the consent agenda. We have had the request to pull item 5.1, 5.2, and also been requested by Supervisor Crandall to pull item 6.5. So we'll go ahead and, are there any more items that need to be pulled? Can you, Jake, would you go ahead and open the room? Is there anyone from public would like to pull an item?
Yes, I will unmute the floor here. The floor has been. Would you like to-
That's the music we need for technical difficulties.
There you go, yeah. Okay, hearing none, we'll go ahead and we'll go ahead and close the room. Supervisor Crandall, is anyone in the room to pull an item?
Hearing none, we'll go ahead and
No, I believe you're asking me for the boardroom?
Yes.
Okay, I do not see anybody in the public that is asking to pull any item from consent agenda. Hold on. No, definitely nothing from the consent agenda at this moment.
Okay, we'll go ahead and bring it back to the board, for action.
Mr. Chair, I move to approve item 5.3 through item 5.7.
second.
There's been a motion and a second. Johanna, can you do roll call, please?
Yes, Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
Aye.
and Supervisor Simon.
Yes.
Thank you.
Excellent. So we're going to go ahead and go to our 6.2 item. Our consideration. Give me 1 second here. Let me get it right here. I do know that there was a request. Actually, let's go to our 6.1 item. Public input. We have any public input?
I have received no public input electronically, so unless there is public input in the room.
And that's what I'm asking for, if there's any public input. So I do know we have folks in the boardroom. Supervisor Crandall? I mean, not Supervisor Crandall, Supervisor Sabatier?
Yes, we have 2 public comments here in the room.
Okay.
If they're for an agenda item, you're going to have to wait till we discuss pulling that agenda item if you're here for that one specific one. If you are going to speak on anything that is not on the agenda at this moment in time, then you can go ahead and make a public comment.
Okay, perfect. Thank you.
So does that negate both of yours comments?
You might want
Okay.
to tell
And as-
Supervisor
And as
Simon
clear,
what the items
Go ahead.
are.
So there's 2 public comments, and they're going to be waiting for item 6.5 when we discuss pulling it. which is, I believe, what we received from Ms. Grant as far as when their comment would be acceptable.
About just pulling the item.
Yes, it's about pulling the item, not the substance of the item.
Okay.
Or at least that's the limitations that they are going to be restricted to.
Okay, if there are no public input at this time, then we will go ahead and we will move forward then. And there is none, correct? They were saying there no public input. Okay.
I'm going to change that. It looks like somebody's getting up. So yes, we have a public comment here in the boardroom. If you can please come to the microphone. And then when you're done with the microphone, if you can grab a wipe and wipe down the area, that would be great. Thank you.
After I'm done?
Yes.
So I'm Joan Moss, and I was led to believe that the final EIR was,
And that would be on
What
item,
was
that would be item
pulled-
6.6.
but it doesn't say that that's what it is. It says that it's a final zoning and amendment. It doesn't say FEIR, so
That's an agenda, that's an agenda item.
It is an agenda.
Mr. Chair?
We'll address, yes, Anita.
Thank you, sir. It's not an agenda item. The reason that was pulled last week was it was completely
Okay.
incorrect. The EIR, the final EIR, had been approved by your board on the 21st. There's no such thing as a second reading of an EIR or any of those things. The agenda item was incorrect, could not be fixed to clearly inform the public of what's going on, so it was simply pulled.
Okay.
But it's on today's agenda in 6.6, right?
Only for the zoning amendment.
Only for the zoning text amendment. That's the only thing that required a second reading.
But wouldn't that be the time to bring up the discussion about this project, or?
Well, there is no discussion about the project. The only discussion is about this ordinance.
She's questioning the process.
I am questioning the process and the fact that I was led to believe that today we were going to have a discussion on the FEIR again. And I want to have that discussion, and I could do it now or when you pull the agenda item.
It's not on the agenda because it's already happened.
But it wasn't explained to the public that it was worded differently. When I was there, Matt is the one that explained that the final EIR had been pulled. So I assumed that you were going to have a public hearing on it again.
The final EIR had not been pulled. Whoever told you that was simply incorrect.
You told me that today, but you didn't, that wasn't explained last week.
And simply what it was just a
Okay,
mistake, and it was pulled, and this is what should have been there last week, what is this week, and this week it was posted on the agenda in the correct amount of time, and so what's there is what we will be discussing today, because everything else has been finalized and completed.
That is correct.
Well, I believe that since I didn't know, and Matthew said it was pulled, that I should be able to speak my piece, but I'll wait till the agenda item comes up. Thank you.
Okay, Joan. Okay, is there any more public comment in the room?
I do
the
not
boardroom.
see any more public comment in the boardroom.
All right, thank you. Okay, we're going to go to our item 6.2, our 9:02 a.m. item, consideration of an update on COVID-19. Dr. Gary Pace.
Good morning. Thank you, Mr. Chair. Good morning, Supervisors. Gary Pace, Public Health Officer, and this is the coronavirus update for this week. Currently, the total cases are 208 with 25 active cases. Nobody's in the hospital. Just to compare to the neighboring counties, Sonoma County has over 1,400 active cases right now, 39 deaths. Mainly, at least over half of those deaths are in the skilled nursing facilities. Mendocino County is at 330 total cases with 9 deaths. Again, most of those are in the skilled nursing facilities. We are continuing to see sort of stable growth of the cases in our county. No significant concerning outbreaks at this point. The neighboring counties are continuing to see some rises and some outbreaks in some very sensitive areas. California overall has had 9,500 deaths. There's been a real increase in cases and hospitalizations over the last couple months, really since about Memorial Day, but that is starting to stabilize somewhat, and there's some hopeful signs that the positivity rate of the testing and the hospitalizations may be leveling off kind of with the statewide average, but there are some pockets that are particularly concerning, and the Central Valley is one of those. In terms of the watch list and kind of the metrics that we're looking at there, we continue to be doing well with that. Our test positivity rate is 3.0, with the statewide testing positivity is 7. We're not on the list now. We are continuing to monitor and talk to the state. There is I really feel like just because of the size of the county and because of our hospital capacity, et cetera, we are, always kind of close to the threshold, but we are continuing to do well. It seems like overall we are prepared and reasonably vigilant, and so things seem to be going okay. Around the state, 38 of the 58 counties are on the watch list, and we're right on the border. So Bay Area and on south are all on it, and north most are not, but we're kind of right on the borderline. Basically 97% of the California population is under those increased restrictions. So in terms of the response, well, first I want to talk a little bit about the data, because there were a lot of questions about that last week. We do have an epidemiologist that's just starting this week. It's going to be 4 to 8 hours a week. She's very good. She was involved with Sonoma County for several years, and we're really lucky to get her, but we don't have a whole lot of her time because of just, funding issues. There's been some real problems on the state level where there's been a big disconnect between their reporting of the data and our reporting of the data. But what it turns out, they just realize now that it's a problem at the state end, and all the counties are having this difficulty of a disparity between where the state's basically undercounting. And it seems to be a data flow issue, and they're working hard to correct it, but it's not there yet. There's also the lag time with the testing portals with Quest and other things, where there can be we've seen up to 14 days now of getting results back. And that severely compromises our ability to understand what's going on. The difference in Lake County is we are going by case. A place like Sonoma where they have 1,400 active cases, they're just having a terrible time keeping up. And there's a data flow coming from the state that they're totally reliant on. We actually, once we get a positive case, a positive test result, our nurses get in touch with that person, and so we track it down. There is the problem of the lag time of when the sample is obtained and the test result comes back. But we, just because we have the size we have and the attention from the nursing staff, we're able to track all these people. So our actual numbers of total cases, active cases, is correct. And if it doesn't match with the state, that's because of lag time and data flow from the state. I think overall, even though there were a lot of questions last week about the data, I think overall our data has been good and gives a good snapshot of where we're at. It's easy to disagree about certain specifics, but I think in terms of what we're using it for, it's overall very good and is guiding us in the correct way. Again, the epidemiologist will be on board, and we can set up a meeting with her at some point if some of you are interested in that, if you continue to have concerns about the data. But she's looking at it now and getting familiar with how we're doing things and giving us some suggestions. So in terms of the testing, again, there have been some challenges. The Verily test site, they got some new staff recently, and I understand that yesterday there was a big kind of log jam of people where the traffic control wasn't good and all that, but we are trying to problem solve that. And overall, I think the Verily site has worked quite well. We were concerned that the state was going to pull funding by the end of August. We haven't committed anything yet, but there are some suggestions that they may be continuing forward. We do have some volunteers helping us, and they have sent some staff down, which has been very helpful. The turnaround time has been a huge problem, and it's a problem around the state and around the country with, again, some of the results taking two weeks and even more to come back. You know, every call I'm on, everybody's got the same complaint. Quest claims that they're working on fixing this. They're going to start doing the batching, which is something you may have seen about in the news, where they're going to run groups of samples together, and if they're all negative, then they can just count them all as negative. If there is a positive in there, then they have to disaggregate and test them all. But it's a way of trying to speed up the process and do more at a time. There's also Quest is starting to outsource to other labs. So as other labs have some capacity, then Quest will start outsourcing some of that. There's something like 120,000 samples in California being done on a daily basis, and so it's pretty easy to see how this could be getting bottlenecked. But still, if we're going to try to really do this response to the outbreak, testing is an essential cornerstone to it. So we're exploring other options on how to deal with things on the local level. We may need to try to get a local machine. We've kind of avoided that because there's been a lot of trouble with supply chain and reagents and things like that, and they're fairly expensive and they're fairly limited in their utility. But as we see more and more problems on the bigger level, we're probably going to have to do some investment locally. One of the things is there is a list that's available, and if any of the businesses are interested in this, they can contact us through the MOAC email, because there's the state's constantly updating a list of commercial labs that will contract with entities individually. So they don't need to go through the health department. They don't need to go through the hospital. They can just contract directly with the lab and take care of things. So school districts are doing this. Some of the big corporations are doing it. And some of them will do billing with people's health insurance as well. So it's another option that businesses may want to take up on, or schools or things like that. Also, the new thing that's coming is LabCorp is the first one in the list that I'm aware of, is you can do a mail-in. So basically, people can go, if they want to get a test, can go get a mail-in swab, do the sample themselves, mail it in, and apparently the turnaround is 3 or 4 days. And so that's much quicker than the Quest lab, and it's another option. I know a few people have tried it. We're just in the process of exploring it and talking with them, but it's another option for patients to be able to do if they want. The latest thing is going to be they're doing strips that will be able to be done on site. This is antigen testing. I was just on a call this morning where they were talking about this, and this is probably what the wave is going to be over the next 6 to 12 months, where people can have strips and they can use it at the school and test people as they're coming in to see if they're positive or not, and they react within 5-10 minutes, and you can get quick results. There's some validity issues and cost, et cetera, right now, but that's probably where this is all going. So, you know, we don't really know how quick it's going to be. Do we want to spend tens of thousands of dollars on machines and reagents if this is going to be coming down the road fairly soon? It looked like a month or so ago, 2 months ago, that the state was really stepping up their response about the testing because it was just a mess. And it improved dramatically, but now the demand is far outstripping the supply, so we're probably going to have to come up with some of these options. The last thing that people can do is go to their healthcare provider. That's always an option. Different healthcare providers have different sort of criteria that they're willing to test for, but that's also another option. So again, just sort of talking about the response locally, the testing, we were talking about the housing situation. Juvenile hall is, my understanding was it started up over the weekend. Elijah House is managing the program, and we're very fortunate for that. The idea is this is going to be a bridge until Hope Center in Clear Lake opens up, and then the services will be transferred over there. We're also using some local hotels for isolation for people that can't isolate at home. The contact tracing is going okay. We've gotten volunteers from various places, from some of the departments, and we really appreciate that. And the state has also supplied 5 people. And the last part of the response is talking about the hospital surge planning. Both hospitals have made good plans for surge planning. If we watch around the state, there's been some significant movement of people out of some of the local hospitals when they got overwhelmed, but it seemed to go okay. And both of our hospitals, we've been in contact with them in the last week, and they've got good plans and are working with their corporate structure to make sure that they have availability. So I think we can be reasonably reassured at this point with that. So the last little section I'll talk about is the sort of the reopening and the long-term planning. Again, I think part of what we're doing is planning for the acute rise in cases, which we've done really well with. And, but we are really on a cusp where things could kind of spring out of control fairly quickly. And so it requires constant vigilance. We are really trying to encourage the kind of procedures to be implemented that we know work in slowing the transmission, and that's masking, social distancing, and avoiding large social gatherings. And this is really what we're seeing from watching the rises and falls around the country. It seems like when they shut businesses down and put these sorts of measures in place, that's when the curve starts lowering. When they back off of that, the curve seems to rise back up. And so we're encouraging people to do as much of these activities that they can to slow things down so that we're able to keep more of the businesses and the schools and things open in the community. Compliance is an ongoing question, as I know, was part of the discussion that was possible today. Other neighboring counties have citation measures in place, and there are different things around the state that are being experimented with. There is a definite appreciation that the governor is aware of these things and is threatening to withdraw funding when there's not clear evidence that counties are willing to go forward with following the governor's orders. I do want to talk a little bit about the evacuation shelters. There's a lot of planning going on for that since we are now in fire season, and there's a lot of work going on to how to do the shelters in a situation where there is COVID around. Certainly having a lot of people in a small enclosed area is a worrisome situation in the time of COVID. The OES with the Sheriff's Department, Red Cross, Department of Social Services with Crystal and her team, Public Health, Animal Control, are all kind of working together on how to set these things up to be as safe as possible. They are, one of the big concerns is that we need to have more social distancing within the shelter, and that lowers the number of people we can have in each shelter. So more shelters are being tried to get established, and we're really working hard on different possibilities around that. Well, and then the other piece of it is the screening for COVID and preventing COVID spread within the shelter. So masks will be required, and so if people are going, need to evacuate and go to shelter, please take your masks with you. Where there's also going to be screening occurring. So the way we're planning on this at this point is a temporary evacuation point will probably be where people get sent, and then there will be some screening, which will be a temperature screen and also symptom screening questions. If everything's negative, then they'll go to the congregate shelter. If there's anything of concern, then they'll go get evaluated by somebody that's clinical to determine whether it seems to be safe to go in or not. Certainly, we would like to have, and if they need to be separated from the large congregate living situation, either because they're a vulnerable person and we're worried about them being in there because if they got COVID, it would be a problem, or if they are COVID positive and are on isolation right now, or if they have symptoms, then we're going to have other kind of setups where they'll be separated out so that we can try to prevent the spread and the entrance of it into the COVID environment. We are encouraging people that if they have other options to try to set those up beforehand, but we're not at all discouraging people from coming to the shelter. it's just going to be more challenging this year, and the way it's been done in the past is going to have to be different this time. And the other thing about it is that testing, you know, it would be really great if we had quick turnaround testing available at the site where we could kind of answer some of these questions in a real way. That's simply not available. And we are trying to get in touch with, we have talked to Lassen County and some of the other folks that have been starting to do some evacuations around the state. And now with a big evacuation down in Southern California, we're going to try to talk to them and see what lessons they've learned so that we can learn from that. So I think, you know, and then the schools, the schools have all met and are making decisions. Since we're not on the watch list now, the schools are able to open in terms of the being aligned with the state guidance. But there's a lot of work going on there, and people are meeting and trying to figure out how best to do it in a safe way, keep the teachers safe, keep the kids safe. And the evidence is changing weekly on how contagious we think it is among children. But at this point, 4 of the school districts, I believe, are planning on starting with distance learning, and some of the start dates are being moved back a little bit. And then 2 of them, Upper Lake and Lucerne, I believe, are planning on trying to do some sort of on-site learning with the kids with precautions in place to try to keep everybody safe. Schools are a big deal, and we're aware of how the impact on the kids and on the community if they're not able to open. But there's a lot of concerns about the health impact from them. So it's just it's a struggle, and it's a struggle all around the country. Everybody's trying to work out. So I think that's it. Basically, we are continuing in about the same space, handful of new cases every day, no new major outbreaks. The hospitals are doing well, and we're really encouraging the community to keep doing what they're doing. Do whatever you can to prevent this from spreading, because once we're on the watch list, it's hard to get off it. And so it's important to do what you can to prevent us from going on there and allowing the businesses to stay open, allow the local control to continue as much as possible. And I think that's it. Thank you.
Thank you, Dr. Pace. Couldn't open up to the board for any questions or comments. Supervisor Sabatier?
Yeah, thank you for that update, Dr. Pace. Not sure if you said traffic issues yesterday. I know that I was there for a little while at the test site. Unfortunately, similar to our situation this morning where we had some technical difficulties. We had a printer go down and having to print out other people's paperwork in order to process them was an issue. But other than that, I thought it was actually a fairly slow day and the traffic went through fine. Maybe something happened after the fact. But overall, I think that the test site logistics have been working out really well. You mentioned we have a 3.0 positivity rate. But then later on, you mentioned that, and that's coming from the state, I believe, not necessarily our own numbers, but that's coming from the state, because I see that it says that on our hub, coming from the state. But then you said that the state is undercounting. I'm kind of curious as to how that impacts the positivity rate and what that would mean.
You're on mute. There you go.
Yeah. If the state's undercounting, so we are getting the positive cases. I don't know, I guess what you're asking is there a discrepancy between what's really happening and what's the state's reporting? Probably so. I don't know that we've calculated our own calculation of the positivity rate. We can do that. I'll get back to you.
Okay. And I know that the state is calculating based on all the health agencies that are doing the tests. That's being provided directly to public health at the state level. Our tests, Verily's tests, and so on and so forth. Are you easily able to collect all that information, and it's just the dissemination of the information to the public that's a more difficult task by collecting all of it, going through it, making sure it's correct? Are you at least getting all that information?
We get the test results when they come back, And so we are getting the test results, and that's what we use to track down the positive cases and do the contact tracing. I think what's happening with the discrepancy on the state is some of what was being brought up last week was that on the state sites and on the local sites, they can be different. And and there's some lag times there and some issues going on there that are problematic. And I'm not exactly clear what you're trying to get at.
So basically, it's good to know what the results are, but do we know how many actual tests have been done? Does the hospital provide that information? Because I know each hospital has their own PIO. They go ahead and release information. Are they releasing that? Are we seeing good collaboration on that? Because I see that it's being collected at the state level, but I don't see it necessarily being shown on the county level. And maybe it's a staffing issue that we don't have time to put all that together. But at the very least, I want to know that we're receiving all that information so that we are aware of what's happening throughout the county.
We receive positive test results. We don't receive all the negatives, I don't believe.
See, and that changes the positivity rate in our knowledge. And I just, and granted, the state is doing that part, but at the same time, I just don't see what's so difficult from our hospital. So maybe I'll be reaching out to our hospital in the district I serve, because communication right now is the key to knowing what's happening. And if all we're receiving is the positive case, then we don't know what our clinics and our hospitals are doing. And again, it's not an issue with public health or the county. We just need all the other agencies that are doing like work to make sure and communicate with us on everything they're doing. Because if they did 100 tests and all you find out is one positivity, then that's 1% positivity coming from there, and that impacts our overall positivity rates. And we're looking at that, and we need to be able to say for a fact that this is our positivity rate and not rely on the state, where now we're saying the state is undercounting. So I need us to be able to make sure we're receiving all that information. And it should be simple in the world that we have with the amount of communication devices that we have. That's my last comment is more of just a soapbox comment. The bottleneck in tests, I don't understand, because we knew we wanted to do 120,000 tests every single day. The governor said that over a month ago, maybe even 2 months ago. So to be surprised that we can't do it is also just a bad organization of, not only do we want to get you tested, but we want to get you the results. And to me, it's an issue of relying on a bad supply chain, kind of like relying on one country to provide all of our medical stuff. They go down, where are we? And so I think that this corporate structure of relying on one entity like Quest to do it all for us is what's hurting us, and we need to figure out how to diversify that portfolio of potential labs. I know at the state level, there was actually a supervisor, I think from Santa Cruz, that was saying the cannabis labs are saying we can do the tests for you. We have the equipment, but I think it comes down to an issue of reagent. But that's just my issue, is we knew we were going to get here, and here we are blocked. We obviously didn't prepare well enough. And I'm talking about the state, not us.
Mr. Chair, Sarah, the epidemiologist, is on, and I don't know whether you all want to invite her to answer some of the supervisor's questions that are more specific to the data.
Yes, I think if she's on, that would be great for an introduction. And yeah,
Right.
if, would like to continue on that conversation, I think that would be a good thing. And what is her name once again, Dr. Pace?
Sarah Marikos, Marikos, and we're very lucky to have her. So hopefully she can get on and maybe answer some of your specific questions, Supervisor.
I do see Sarah just popped up on the screen here. So it looks like you're still on mute though, Sarah. I don't know. There you go. Welcome. Nope, we still can't hear you.
So she is unmuted. It looks like you might have some hardware mute or something on your device, Sarah.
Can you hear me now?
Yes, we can hear you now.
Wonderful. Hello.
I wanted to, it's helpful, it's nice to meet you all, and I look forward to working with you and the Public Health Department to support the response. I'm just getting up to speed with your systems and your team and your data and the state indicators and some of the challenges there. I did hear the question about the positivity rate, and just wanted to comment on that, and certainly can come back with more information. I think the challenge there, and I think it's important to be clear, it's that the data are delayed, but the rate is correct. So it's just unfortunately right now not the most timely measure. The state is making efforts to improve the timeliness of that. And then my understanding, but would like to come back or, inform Dr. Pace on this once I get a little more clarity regarding the testing. But my current understanding is that the numerator, so the total number of tests being done and then completed with results, which is the denominator, and then the numerator, the total number of positive tests are being reported. So it's not an undercount of the denominator when we're looking at the percent positive, at least through the state system. So I do believe that's an accurate measure. It's just a delayed measure. So I hope that's helpful, and can certainly come back next week or at a future meeting and provide further clarity.
I appreciate the clarification, and very nice to meet you virtually.
Yes. Great to have you aboard, Sarah. I know there are a lot of questions on the data and the information we're putting out, so glad to have you part of the team. Thank you. All right, any more questions from the board? Comments? Okay, Supervisor Sabatier?
Just one last comment. I asked the state yesterday about, we were expecting, and I talked with Public Health, they were expecting it as well, an announcement about the Project Baseline, the continuation of their testing, because right now, August 31st is the end of the contract between the state and Project Baseline. It's been finalized, but they didn't tell me if it's finalized as in it's going to end and expire, or if it's going to continue, but they are anticipating again this week to let us know how that's going to go, because that's an important part for us. That's what's allowing us to get the number of tests that we're getting done, and it's important to stay above that threshold for the local variants that we signed into. So I just wanted to update that. Hopefully before the end of the week we'll get some kind of announcement.
Thank you, Supervisor. Any more go ahead, Supervisor Crandall.
Dr. Pace, just have a question, and I think you've answered this numerous times, but I want to just ask again, who is conducting the contact tracing in our department, in your department?
Well, so, it's evolved over the 5 months. We've had, the nurses have been the main ones doing it. Now what's happened is as the number of cases were increasing, we were needing to get some help. So there's been people trained from other departments and from the community. And we also have 5 contact tracers that are in from the state now that are, working virtually, but that are trained by the state. And so we have I think it's probably 15 to 20 people that are trained and available. And, as the number of cases goes up and as there's more mobility in the community, there's more contacts that need to be tracked down. And we're keeping up fine now. Other counties with higher numbers of cases are really struggling to keep up. And that's really when, that's part of the variance measures that they talk about, is if you aren't able to keep up with the contact tracing, then the outbreak kind of spins out of control. Whereas if you can keep up with the contact tracing, you're much more able to control it. So anyhow, that's.
Thank you. Is that aspect affecting your funding or your budget at all? Or is that a question for Denise?
Well, if Denise wants to weigh in, she'll probably give you a more precise thing. But, most of these people, so our staff is pretty overwhelmed, doing a lot of overtime. And so that's a big piece of it. We are bringing in some people from other departments right now that don't come under the public health budget, I don't think. There's some volunteers that are volunteers, but, you know, they require some sort of coordination and oversight and training from our department. And then there's the state folks coming in that doesn't affect our budget. Other counties are paying these people, you know, so that's part of the money they're using from the CARES funds is to pay contact tracers and things. But we're really kind of working to backfill what's being done from county staff in that direction. So,
okay. I do see that Denise Pomeroy has her hand up, Eddie, so I'll go ahead and Denise, go ahead and speak. You're up. Oh, we can't hear you for some reason. We can see you talk and we can't hear you though.
That looks like the same issue, Denise. You were unmuted, but you might have a hardware mute. But I'll try unmuting you here again.
Go ahead, Denise. Can you hear us?
Yeah, it looks like we're still not getting audio from you.
Okay. I know she has some stuff to say.
Denise can dial in with her phone if she'd like. You may want to take other comments to give her time to do that.
Okay. Are there any other comments from the board at this point? Okay. Hearing none or seeing none, we're going to go ahead and if Denise can get in, we'll go ahead and let her obviously chime in when she gets some audio on that specific question or when we come back to the board. So we're going to go ahead and open this up for public comment. And at this point, there we go. See a couple of hands up. Okay, Jake, let's go through. I see one hand up here. D. Parker.
Yeah, sorry. D. Parker, I've sent you an unmute request.
Did it go through?
Yes, we got some background.
Just give me another sound check. It looked like it sounded like we were getting some feedback from you.
Hold on just a second.
That's not healthy.
Yeah, sorry, D. Parker, I had to mute you again. There sounds like there's a feedback loop on your end.
Okay, I think I took care of it. Can you go ahead and unmute me again?
Yeah, you're good now.
Okay,
you're unmuted. Go ahead.
Okay, so I actually have a couple of questions, technical questions based on the ordinance, and then I'd like to come back in later.
No,
and maybe
we're not talking. This is Dr. Pace's report. The ordinance. Yeah, the ordinance has been requested to pull. If you're talking about item 6.5, and that's.
All right. Okay, thank you so much. I just, for Dr. Pace on his report, so what I'm hearing is your major concern or the thing that is the key to success here could be the testing, to get ahead of the testing enough so that we're prepared for whatever is coming. If we could do that, would that mitigate many of the other factors that are driving what's happening in the counties around us?
Go ahead, Dr. Pace.
Well, so the testing is one piece of all this. What the testing's really important for is to identify cases, especially people that are asymptomatic, and so we can isolate them from having contact with people that are not infected. This is how you stop the spread in the community. And without testing, we can potentially guess for people that are symptomatic, but there's something like 40 to 50% of people that are contagious are asymptomatic. So there's no way they know they're spreading. So the testing is one piece of it, and the masking, social distancing, avoiding large gatherings is another way of slowing the spread, because pretty clearly that these ways are showing that you can slow down the spread. Like for instance, when we have a positive case, so if we have a positive test, then we go in and do the contact tracing. If people have been wearing masks, they tend to not, the contacts tend to not be positive. If people haven't been wearing masks, or in the household or places where they're not wearing masks, that's we usually see many of those people turning positive. So the testing is one way, that's to identify who's contagious, and then these other ways are mechanisms that we're putting in place to slow the spread. And if we don't know if somebody's positive, if everybody's wearing a mask, then that's one of the ways of just stopping community spread without having adequate testing. And I guess the last piece of to say to that is that, and then the ultimate thing is to basically shut things down like happened in March and April. And what we're seeing around the state is trying to pick the highest risk places like bars to shut those down instead of just shutting down everything. But these are all different ways of trying to slow down the social contact, which is where the virus spreads.
Okay, so I guess my second question is, what are your, I don't know if this is the correct place to ask this question. So for the elderly or the vulnerable people who we're trying to protect, but at the same time, certain things actually add to their vulnerability, such as masking. There are some people who are that this is affecting. How does this report deal with that issue, I guess? And this may be the wrong venue, this might be the wrong area, but I mean, if I want to talk to somebody, it's you. I want to talk to you because you're the expert, or one of them. If we say that, it sounds like you're saying that testing is one key, that if we can find people who are asymptomatic, I guess isolate them. And it's my understanding that you can, and please correct me, you can catch this more than once. You can, or it mutates or however that works. And I'm not totally clear on that. And the testing is only good for like that day. How does all that circle around? And forgive me if this is the wrong time frame to ask that question.
Do you want me to do that?
Go ahead, Dr. Pace. Okay. Yeah, if you have an answer for that.
Yeah, so the testing question, basically what we're looking for is if somebody's contagious at the time of the testing. So that's what the test does. It doesn't tell us if they've had it before or if they're going to get it. It tells us if they're contagious right now, and if they are, then we separate them and try to keep them from being around people that aren't infected so that it doesn't spread through the community. The question about can you get reinfected is not clear yet. They're still doing studies on it, but most likely you can't get reinfected, at least for some period of time when you have the immune response. Maybe for months to a year to more years, we don't really know yet, but that's what the antibody test is trying to determine, and there's still a lot of research going on about that right now, but there's no guarantee that if you've gotten infected that you're not going to get infected again. But most likely, most viruses tend to have some immunity where you at least have less chance of getting infected again. Your question about the vulnerable populations, we're doing a lot of work to try to keep the people in the nursing homes safe. The nursing homes in the county, the three of them, have been very active and very engaged and really good partners around trying to test everybody in the place, trying to test their staff, trying to protect people. We've been limiting visitors. We've been, there's a lot of work going into trying to keep these people safe. And I think that's why we don't have outbreaks like the other counties have had. And we're very, very fortunate because that gets really problematic when that happens. The question about the masking, I know there's a lot of controversy out there about this. Really, in the medical world, most of the evidence is that most people don't have problems with cloth masks. And, it's, and if people do have a big problem with a cloth mask, and, at this point, what are basically saying, then stay 6 feet away from everybody else, because that decreases the risk of transmission. It's not as good as a mask, but it's something. And, really the goal here is trying to slow community spread of the virus.
Thank you, Dr. Pace.
Okay, I just have one more question for Dr. Pace. Would you be available, I don't know, through email or whatever, to help? And I understand that the rate of people who struggle with masking for health or whatever reasons, are you available to work with a group of people or someone who says, hey, how can we facilitate their functionality in this community without, putting others or themselves at a greater risk, doing it in a responsible and a respectful manner? Is there an outlet?
I would love to work around that for sure. So yeah, you can email me at email to the MOAC, the MHOAC at lakecountyca.gov, or go to our website and go through that. And just let me know that pretty much if people invite me, I come talk with them and we can kind of work these things out. That's exactly what needs to happen in the community, is to get folks to try to figure out how to do things respectfully with each other and not blame each other and try to keep each other safe. So I would love to do that. Yeah, thanks.
Absolutely. I couldn't write that fast, so I'll let go of my time and I'll find you.
If you go onto the website, the Lake County Health Department website, it's on there.
Okay, thank you so much.
Thank you, Dee. All right, we're going to move to our next hand up.
All right, the next hand up we have is from Johnny. Johnny,
Johnny,
Can you hear me?
Will you confirm your first and last name?
Johnny Garcia.
Thank you.
Just a question about the testing and the positivity rate and the negativity rate. So I miss why the negativity rate isn't updated daily. So if you could give me that reasoning one more time. And then also the positive cases that happen daily. How many of those are actually still positive, or are you just going off of, they tested positive, so we're just going to update it positive? Because I know that you've said before that the test results are late by 5 to 7 days usually. So I'm curious exactly how many are positive, or are you just saying, they tested positive, we're going to update it as positive? And if that's the case, maybe you guys could update the time the test was taken, like you guys do with the water. When you guys test the water, we tested the water so-and-so date, it came back positive for that test date. Maybe that might help with the panic of the cases in the county.
That was a question or a comment. Go ahead, Dr. Pace.
Well, so the way to look at the hub is we update it every day during the week, Monday through Friday. I think it's by 1:30. So once a day it gets updated. And if you look at, I think the question you're asking, so total cases is anybody who's had a positive test that lives in the county goes on the total case. So, but the active cases is what you're talking about. So those are the people that are considered still infectious and that are within the window of being positive recently. So that's the one I think you're talking about, which is the current active cases. So that's the one to look at. And, it's not a high number right now. We're running, usually about 20 at any day that are still considered active. People will drop off that list after they've been positive for 10 days because they're considered no longer infectious. The negativity rate, I'm not sure what, so I just got input from our data team that what Sarah said was correct, that we do eventually get the positive results quickly. So if one of the local hospitals gets a positive test, we get that as soon as they get it, so that we can go do the case investigation and contact tracing. The negatives don't come directly to us. They go through the state and eventually make their way to us. And so they do all eventually, like Sarah was saying, the denominator is correct. It's just there's a lag time. The numerator goes up a little quicker because of we get the positive rate more quickly. But we're not, again, I think that's all through the state. So I'm pretty sure that the number's probably correct in terms of positivity. It's probably just a window of a week or so ago.
Thank you, Dr. Pace. Thank you, Johnny. Okay, Jake.
Okay, the next hand we have up is actually Denise Pomeroy.
Oh, here we go. All right.
Okay, can you hear me, board?
Yes.
Yes.
All right, thank you. Sorry about that. New equipment, not working quite right yet. So I want to make sure that I heard the question right from Supervisor Crandall. Your question was whether the public health or health department budget was being affected by the response work that we're doing, correct?
Yes.
Okay, so yes, it is being affected. We're, as a self-funded department, we have a significant amount of programs that we work and we run for our community. With this type of response, the majority of our staff have been pulled off of their normal work, not working in those programs and working on this response. So we're unable to bill for work in our normal programs because we haven't been doing it. We've been working strictly on COVID-19. So yes, it does have an impact. We are scheduled to get some backfill 1991 realignment, and we are working to hopefully receive some of the CARES Act funding for continued response on this.
Thank you very much.
Yeah, we have received some funds from the state as well for response. So our emergency preparedness budget doubled, although we've blown through that already. And some of the other programs have provided us additional funding for the response.
Thank you, Denise. That answers. Thank you very much.
You're welcome.
Yes, thank you. Okay, Jake. Look, we're good.
All right.
Jake, let's put the next hand up.
Yes, the next hand we have up is from Latoya Fortino. Latoya, I've sent you a mute request. Looks like you're unmuted. Will you please confirm your first and last name?
I am. Thank you. My name's Latoya Fortino.
Great, we can hear you.
I just wanted to make sure I clarified because I heard Dr. Pace was stating that, and maybe I wasn't understanding it correct, is that we don't keep track of the negative tests. We get a lot of the positive tests back. Is that correct?
Well, I said something to that effect, but I was mistaken. My data people have corrected me, and so we do get all the negatives and all the positives. It's just there's a lag time. So there's a delay because we get the positives quickly from the providers themselves. So like if one of the local hospitals tests on their machine and they get a positive, we'll find out quickly so we can do the case investigation, the contact tracing and everything else. If they, the negatives though, don't come directly to us, they go through the state and eventually get back to us. So there's a lag time in terms of getting what people were talking about was the positivity rate. So the number of positives divided by the total number of tests. There's a lag time with that, which is but when there's a positive case, we find out about it quickly.
Okay. Thank you. Because I actually am on our health website for our county. And I can't imagine the amount of work that has to go into these things. But I also think that so much of our negative is being highlighted. And if we looked at the amount of tests that our county has actually done, we only have 3% of the amount of tests that are positive and 97% that have come back negative. And so thank you for that clarification, because I was just curious about that.
Okay, thank you very much. Okay, Jake, let's go to the next hand.
All right, the next hand we have up is from Jonathan Cronin. Oh, oops. Jonathan, I've sent you a unmute request. Looks like you're unmuted. Will you please confirm your first and last name?
Yeah, this is Jonathan Cronin. Do you need any volunteers for the contact tracing? It sounds like you're kind of short-staffed in that area. And if you do need volunteers, where do we volunteer at?
If you're interested in volunteering, we can use volunteers for various things. And so probably the easiest way to do it is to write to our MOAC email line, MHOAC@lakecountyca.gov, which is, or you can go on our website and get it from there. But if you write and say that you're interested in volunteering, we have somebody who's coordinating volunteers for all sorts of things. And yeah, we can use help all the time. And if and when the cases increase, we'll need more. So we encourage people to let us know if they're available.
Thank you. Thank you, Jonathan. Okay, Jake, let's go to the next hand.
All right, the next hand we have up is from Matthew Nelson.
Okay, let's go ahead and go, Matthew.
Good morning, Dr. Pace. How are you?
Can you please state your name, Matthew?
Matt Nelson.
Can you hear? Yes.
Okay. Good morning, Dr. Pace. How are you?
Fine, thanks.
Good. I wanted to ask you, you'd mentioned earlier about the communication, and I respect that highly. I was curious to know, due to the limited time and the rushed guidelines based on the Board of Supervisors meetings and whatnot, amongst other things, there's a lot of people that have a lot of questions that just can't get the information that they're seeking out during these periods of times. The information that you provide in your statement is very good and very clear, but there are some follow-up questions that I know that a lot of people have asked that they need clarification on, understanding as a whole. Would you be opposed to holding like town halls via Zoom or something of that nature on a weekly basis so that people could go to the county website and link up with you and you can afford that time to go through questions, just so that everybody is able to have their questions asked? Is that a possibility?
What kind of questions? I'm curious.
We can consider that.
Supervisor Brown, go ahead.
I'm just curious what kind of questions.
Sorry about that, Dr. Bates.
Well, there's people that don't understand a lot of the numbers and whatnot. I've been asked, so I wanted to go to the professional.
Okay, so I just want to make sure we're saying the same thing here. You're saying that there are people that have questions that they're not able to get, that haven't been answered. So I'm not sure what questions are those. Not what are the numbers. He's given the numbers. The fact that they don't understand the numbers, or we don't understand the numbers, or a lot of them I don't understand, but taking time away and doing a Zoom town hall may not resolve that, but I just want to know what the questions are.
The questions are that of the numbers, okay? There's a condensed amount of time that is spent here. There's people that are not able to get on the Board of Supervisors Zoom meetings or go attend in person, and by the time they get there, the watching it in a review or recorded on Facebook, they're not able to ask the questions. You see what I'm saying? So I don't see what
you're saying, because you're saying,
but what I'm trying to say is, will you make yourselves more available to the public, because we're in a pandemic crisis or what have you? There's a lot of rules that are being passed down, and a lot of Governor Newsom's guidelines that, they need to have certain, can I explain what I'm trying to say? You're asking me a question. So if he's having all these impending orders coming down and he expects the county the counties to follow them, the constituencies within those counties want to know exactly what is happening and have their individual questions asked, because the guidelines and the time frame of which a Board of Supervisors meeting does not afford the amount of time for people to ask those questions, because they've sent in emails and yet they get either no response, a vague response, and people are getting angry. That's where I'm coming from. So if the doctor wouldn't mind affording some time, not just making it a petty thing of, well, just make a Zoom thing and whatever. No, make himself available to the public is what I'm going at. Thank you for your time.
So while I have disagreed with some of the stuff that's happened, he's made himself very available. So I think that's rhetoric, and I'm not sure what the purpose of the rhetoric is, but it's not productive. He's made himself available. I listened to you. I listened to you. I didn't interrupt
you. You can go ahead and address your comments to the chair, please. Myself, Matthew, go ahead.
I can't think of one single person who's been told we're done here today. We can't keep asking questions. We go till the questions are answered and we're done. So we move on. So I think.
Okay, this is exactly what I'm talking about, getting shut down.
Nobody's shutting you down.
There's a lot of people
Nobody's
that are
shut you
saying
down.
that they have questions and they get shut down. So thank you for proving my point.
Nobody's gotten shut down. When you ramble on, sooner or later, there's got to be an end to it, but nobody's shut you down.
Okay, so it's not a good thing to have the availability for the public to ask the questions they want to ask.
You can ask a question in such a way as to spin your agenda, but I'm telling you that I'm not curious. You said
I don't have an agenda, Rob. What I'm saying is okay. I'm trying to answer questions for people that have brought them to me, so I'm taking them to the doctor. But then I get jumped on by a supervisor that doesn't agree with it.
Who jumped on you? Who jumped on you? Who jumped on you?
Hey, I'm trying to talk to the doctor.
I think you're a little bit.
Talk to the doctor.
I think you're a little oversensitive. I just asked you what the questions were. That's all I asked you.
Responded back to.
Yeah,
Point of order, please.
Nobody jumped on you.
Point of order, please.
Yeah, we are going to bring this back to a point of order. Matthew, I know your question was, if Dr. Pace would make himself more available. We are doing these on a weekly basis to try and get as much information out there as possible. I know the Mohawk also has the email where questions can be asked, communicated many times for the public and other things, especially our business owners that are going through this situation at this point. And I know, people are available. Dr. Pace is available. Denise Pomeroy, questions and problems are trying to be solved. So do appreciate your point of view, and we'll continue always to work. I think our meetings we're having now are open. We are open. We try and let people speak and ask their questions when they have specific ones, and we'll continue to try and do that.
I appreciate that. What I'm trying to get at is Dr. Pace was saying, earlier when he was doing his YouTube updates earlier on in this crisis, it would allow people to watch. And simply what I was trying to get at was, instead of doing it just as a recorded YouTube, if he would make it possible to do a Zoom or a live so that people could ask the questions. That's what I was wanting to ask, because there are emails that are going out, which folks have let me know. And to just clarify for the other supervisor, I'm not pushing an agenda here. I'm speaking up for the concerns. And thank you for your time. And that's exactly where I was going from a YouTube thing to a Zoom time thing. Thank you.
Thank you, Matthew. Okay, Jake, I do not see any other hands up at this point.
Mr. Chair.
On the board here. So what we'll do is we'll open up the room, see if there's any comments, and then we'll bring it back to the boardroom.
Mr. Chair.
Supervisor Sabatier.
I just want to, there was individuals that were not added as far as who can help out with obtaining answers. That's what we're here for as well. And so every email I receive, I go ahead and have that conversation that I need to have with public health or Dr. Pace. And we are an intermediary. We represent everybody in our district. And if they're not getting answers, then they need to reach out to us so we can make sure and provide that assistance in getting them answers as well. So I agree agree with what was said, that Dr. Pace is making himself as available as possible. He was on the radio this weekend. He's here right now. I would hate to see him taken away more, but at the same time, that's up to Dr. Pace, not us. He knows what kind of time he has available to himself. But I know that please use your Board of Supervisor if you're not getting the answers you're getting, because that's what our job is to help you make sure you know and understand the situation that you're dealing with.
I want to say that too, because
Go ahead, Supervisor Brown.
we're all available. We're here every single Tuesday, and I realize it may not be convenient for some people. I get that, but to have somebody available 24/7 for people who need a different time. First of all, the caller said the questions weren't being answered, and then he's unable to give one single question. And it gets frustrating when we have staff who's working 24/7 to be accused of not being available and all that. And then, you have a caller who probably ought to get a little thicker skin if you're going to be in this business and not think somebody's jumping on you because they're asking you a question to clarify the question you asked. So that's the rough life we live. So thicken up a little bit.
Thank you. Okay, we're going to go ahead and open up the room. Jake, go ahead and open up the room.
All right, I will open up the room here. The floor has been unmuted. If you'd like to make a comment, please start by stating your first and last name.
We'll get to the boardroom in a second. We're going to go through the virtual first.
Yeah.
We won't skip you.
Okay, Jake, hearing none, we'll go ahead and bring it back. Supervisor Sabatier, go ahead and we'll move to the boardroom.
Yes, will the next person who wishes to make a comment on this item please step up to the microphone? And again, after you leave the microphone, if you can please clean up behind yourself.
Thank you, Supervisor
The less you
Sabatier.
touch, the better.
Good morning. First, I'd like to...
Hold on one second. Do we hear our public comment? Is the microphone on?
We do hear the public comment. If she could please state her name.
Thank you. I'm Paula Mune. First of all, I want to thank Dr. Pace, who was on KPFZ FM 88.1 this past Saturday and Sunday for an hour each time he was on. I'm very impressed that our BOS meetings allow 24 people from the public to attend in person. I am disappointed that 6.5 may be considered for removal.
When we get to that item, we will go ahead and talk about that item.
So I'll be able to make a statement then?
Yes.
Yes.
Okay, then I will. But also, I just wanted to say that I wanted to make a statement in remembrance of the 4 million cases of COVID-19 in the United States and of the 155,000 that have died. And also, I did want to speak to the issue of the COVID-19 enforcement ordinance, so I will wait for that time. Thank you.
Thank you.
Make sure you wipe it off.
Okay. Okay.
It's a process.
Perhaps the next person could just, start walking up because, okay, this is done.
Okay, all right, Bruno, do we have someone else coming up to make comment?
Yes, we're finishing the sanitation process.
Okay, thank you. Good job.
I'm not going to remove my mask and try to be,
We can hear you.
okay, fine. So on my drive down from Upper Lake, I was listening to KPFZ and Olga said, your next item has been pulled. So it was too late for me. I went ahead and came down because I really want to speak to the urgency ordinance.
And you will have your chance to at least
The
speak about...
public will have a chance to say something
speak about pulling the item, and if it gets pulled, then we cannot speak on the substance of it until it comes back.
So
Yes, absolutely, yeah.
so I wasted my time coming down here because that's what's going to happen, right?
And you can discuss that for why you want it not pulled, because that would be that
Okay.
comment. So yes, on 6.5, you'll be able to come back and discuss that.
Okay, thank you.
Sorry, Mr. Chair, if
Is
that's
there any
not...
other public comment? Is there any other public comment on this item, Dr. Pace's COVID-19 report?
I do not see anybody raising their hand to come forward.
Okay. All right, then we'll go ahead and close public comment on this item. We'll go ahead and bring it back to the board. If there are any other questions or final comments from the board, go ahead and raise your hand. Supervisor Scott.
I just want to make a comment and thank Dr. Pace for being as available that he is. He's on the radio. I know when constituents email me with questions and I don't know the answer, I will email Dr. Pace and he will get right to it to help answer those questions. So I just really appreciate everything that he's doing and his department. They are doing an amazing job trying to keep this community safe. So just thank you.
Okay, Supervisor Sabatier.
I just want to say, and I'm going to repeat a few of the numbers that Dr. Pace gave us, 3% positivity rate. At one point, we were kind of hovering at the 5.5. Just the number of active cases that we have currently, we've dipped down to 11. We've climbed back up, but we haven't gone back to our maximum, which was 44. He said some words, continuing to do well, we are the state is starting to stabilize, no significant concerning outbreaks. So I just want to say thank you to, this is not any one person that can make this happen. This is the entire community. I'm seeing more and more in our community that are doing exactly what we're asking them to do. I'm seeing businesses make an extra effort to go above and beyond what they were doing before. So I just want to say thank you to everybody, because it's all of us that make those numbers. And the fact that we're not on the watch list, the fact that we have the numbers we have are based on the entire community. So I just want to make sure and say thank you to everybody.
Thank you, Supervisor Sabatier. Yeah, I would like to add one final comment too about to really address the availability issue. I know we've had some businesses down in South County, specifically in Milltown, that have been affected. It didn't matter what time of day or what was going on. The health department, Dr. Pace, everybody has done a great job. It's a new reality over the next 6 months to, who knows how long for businesses as they're going through this. There will be cases, and having the public health department, Dr. Pace and other folks to help guide people through these situations are just critical. Because as a business owner, it is devastating when you get the call, but it's a reality, and you got to be ready to move quickly and nimbly to not only protect your employees, your community, but also your staff. And, it just is, I just want to say thank you very much, on behalf of business community and business owners that are affected by this. Thank you very much for being available when those situations do happen. And it is the new reality. It will be happening to more. If it hasn't happened to your business, it may in the future. Please have your plans in place, be prepared, and please reach out to the public health officer, Dr. Pace and his team, and Denise Palmer, anybody, in that department and all across the county. So thank you very much. That's all I want to say. All right, if there are no more closing comments or questions, we'll go ahead and we're completed with this agenda item. Thank you, Dr. Pace.
Thank you very much.
Okay. We're going to go ahead and move forward here. I know we did, what I would like to do is go back to the two consent agenda items that were pulled. Item 5.1.
Mr. Chair, I need time to get the animal control director here, but I will reach out to him right now.
Okay. Are we ready to address item 5.2 then?
The behavioral health director was here earlier. If he's still in the room, Todd Metcalf, are you still in the room?
I see him.
Todd's.
I will get both of them back in here, Mr. Chair, as soon as I possibly.
Yeah, I see Todd. Todd is here and he does look available. Todd.
Okay.
You unmute yourself. Go ahead.
Yeah, here.
Go ahead, Todd.
Well, so good morning, Mr. Chair and members of the board. My name is Todd Metcalf. I'm the Director of the Behavioral Services Department. This to item 5.2. Can I just say that this is something new for me. I've never dealt with an agenda item like this, where we are calling on a county policy that allows us to permit someone to take leave without pay. We budgeted for this item in March of this last fiscal year. And I just want to say that this is an investment in our workforce and ultimately does affect local economic development. We currently contract out of county for psychologist services. And once this individual, Ms. Mathis, does complete her internship and receives her PhD, she will be able to provide these much needed services in-house, keeping the monies here instead of contracting out of county, because we've all talked about this over and over again. What I would like to ask is that this item be approved today with some kind of a stipulation that we draft, an agreement with Ms. Mathis saying something about we approve the paid leave, but it's contingent upon her return to work for X number of months or something like that. I don't know if that's something we can do. She has assured us that once she's completed her internship and receives her degree, she will come back and be able to provide these services. But Supervisor Sabatier and I had a little bit of a communication about this via email sort of over the weekend. And I like the idea of maybe doing something like that, but this is something new for me. So I'm not sure how to proceed, but I would like to get this approved with that contingency that we draft some kind of an agreement. And I guess I would have to work with HR and county council to come up with the right verbiage for it. But again, this is an investment in our workforce. This will ultimately, and I would say long-term, maybe even shorter term, save us some money so that we will not have to contract for this type of work out of county. So I'm asking that if this item is pulled, that it comes back to the board next Tuesday, perhaps with some sort of a draft agreement with the appropriate verbiage that says that Ms. Mathis will come back to work for us and provide these services.
All right, thank you very much, Todd. Supervisor Sabatier?
Thank you very much, and thank you, Director Metcalf, for that. I think I heard you say two different things. I think I heard you say without pay, and then I think that you said with pay. And the way that I read it here is it's being requested with pay, and that's a whole year's worth of pay while they're away getting educated. I'm all for providing training to our staff and helping them step to the next level of what we need here. But when it says here that less than 50% of their salary will be taken care of by the student stipend, and that we're going to pay the rest of the salary for a whole year without any stipulation that we're going to get that service back, we know we are a training ground, and I want to make sure that what we get is actually going to benefit our community and not have someone leave for better pay somewhere else because we provided them with the tools to get trained. I want to support this, but I want to support it with a contract that protects us and make sure that we're investing in our community and not just in someone else's specific training that they can take somewhere else. I would like to see something similar to, I believe our sheriff has a similar program with those that go through the police academy.
Yeah.
I want to see something similar to that where we're going to see the benefit, and each year that they provide the service here, it reduces what the cost was of the extra salary that we paid.
Mr. Chair?
Yes, Anita. Go ahead.
If I may, you do have an issue here with regard to gift of public funds. And it's not to say that there couldn't be a benefit to the county, but this would have to be something that your board would give some consideration to and some direction to staff. And I doubt very much that an agreement could be put together on what could be, because I don't believe there's any policy in place for this. There'd have to be some research, etc. I doubt very much an agreement that would address the concerns that are being raised here by Supervisors Sabatier and others. It could be done by the very next Tuesday.
Okay. Thank you for that input. Thank you, Anita. Other board members? Supervisor Scott?
Just that I agree that, we want to educate our employees, and, I'm all for educating, but I agree with Supervisor Sabatier. I would like to see something in place stating that they're going to give us X amount of years back after continuing this education. Anita is stating that it would not be possible for it to be brought back next week. So what kind of timeline are we looking at if we do agree that this
after
want to go?
I don't think it would take beyond the 18th, Supervisor, but pushing it to the 11th, today's Tuesday, it would have to be in tomorrow or Thursday at the latest. That's quite quick to draft an agreement like this.
Right. No, I agree, but do you think that this is something then that you can put together for us to be able to make this happen?
That's a very good question. I won't know probably for a day or two. There may very well be a way. It may not be exactly what's envisioned, but again, if your board gives direction as to what you'd like to see, then what I can promise to do is get as close as the law allows.
Thank you.
All right. Thank you, Anita. Thank you, Supervisor Scott. Supervisor Brown?
So it's always dangerous to craft an agreement or policy based on an individual. We have a precedent that's been set through like Bruno said, through the Sheriff's Department and the Academy and that type of thing. And I think we should try to stick as close to the policy that we already have with existing employees. And if we're going to change that, or if we're going to make some kind of accommodation for an employee, that we anticipate we can do it for any employee and not just an employee. And and have this come back as a discussion. And I don't know, Anita, maybe it's a closed session item for negotiations. I don't know, but and the other thing.
Well, that's a good question, sir. It would depend upon really what the research indicates, frankly.
Yeah, and the other thing is, I don't think it matters. I don't think we need to pin a date down. I think get the information to county council when they get it done, bring it back to the board. However it looks, whether it be in closed session and we talk about it in terms of how it affects all of our employees, or at least a group of employees as opposed to a single employee. I think it's a bad idea to craft policy and agreement just based on one employee's needs.
Thank you, Supervisor Brown. Supervisor Sabatier?
Thank you very much. Yeah, I agree that it needs to be more of a global policy than just an individual policy. And I know that Director Metcalf is pushing because of the August 31st, 2020 training start date. And I mean, while the policy is not in front of us and the details are going to be important in the policy, I just want to make the statement that I absolutely 100% want to support this staff member, but we need to make sure that we do it in a way that spends our public money in the correct way so we get the return on our investment.
And Mr. Chair, if I may, it's not just the expenditure of funds. There are other legal issues associated with this as well.
Right.
So.
Okay. Excellent. Any more comments from the board? All right, seeing none. I'm in agreement with, looking into it, see if this is an opportunity for us, but as a global policy or issue. I would be in agreement of bringing this back at a later date, not setting one today, but having the opportunity to do that. I think the concept is there, as Supervisor Brandon Sabatier has said, and could be beneficial if we could work something out for the entire workforce. So Supervisor Sabatier?
Yeah, I did want to mention one more thing, just in case this happens in the future. This requires a 4/5 vote, and I hope that in the future we make sure this is on the normal agenda, not the consent agenda, because I think a 4/5 vote should definitely not rely on a consent.
In agreement? Okay. All right, we're going to go ahead and open up public comment, and I see we have a hand up right now. We have Sheriff Brian Martin. Jake, can we open up Sheriff Martin's line?
Yeah, sorry, working on it.
Okay, can you hear me?
Yes.
It sounds like there's some music playing in the background.
It's a little bit of background noise. I'm working remotely today. Can you hear me?
Okay, go ahead. Yeah, we can hear you. Go ahead, Sheriff.
Okay, the Sheriff's Department does have a program with the trainee position. Some of the issues that we grappled with is the inability to recollect an employee's salary. There was a court decision that came out of Los Angeles with Los Angeles PD, and the agencies were able to recover the cost of the training that an agency provided, but not necessarily the costs related to the actual employee. So it's a situation where we want to keep the employee committed to a certain number of years, but our major expenditure is a year's worth of salary. I don't think that we're going to find the ability to do that. Paying for the cost of the training, certainly something that's allowed for and has been clarified by the courts. So this, I think what Supervisor Sabatier was talking about, calling our investment in public funds, obviously that's a pretty significant amount of investment for a year's worth of salary for an employee. I don't know that it'll be possible to cover that if the employee decided to go elsewhere. Not saying that you fully agree with our desire to support our employees, but just know that when we're going into that might not be something that's available.
Okay. Thank you very
Mr. Chair,
much for your...
Could I also speak to this issue? I have past experience with this type of thing as well in my prior position with the county. We had social workers that were enrolled in a master's in social work degree program, and they worked full time, and they went on weekends for the training. And the training was, the master's program was provided to them free of charge, and they entered into an agreement to participate in that program, in which they agreed that they would continue working for the county the same number of years that they were enrolled in that program. And so it was a 2-year program, for example. They were committed to the county for the 2 years following that. And for the most part, it worked out very well. But there was 1 or 2 occasions when the employee decided to leave county employment despite the requirement in the agreement that they continue for the period of years that was equivalent to their education. And at that time, as much as we wanted to prevent that from happening, we were not able to do so. There was really no way to hold the employee to that agreement. And so they got benefit of the program and then left county employment. So I too want to find all ways possible to support our employees and their professional development. But this is something that we do have some experience with, and I think we would need to give considerable thought about what sort of a policy would benefit all employees potentially.
Especially now that we can go virtual.
If I could, I just wanted to add, there are a lot of additional training components and educational components for county employees and ways that has been handled. That's why, as I'm saying, it's a more complicated issue than just you do this, we'll do that, particularly given the circumstances of not being able to at least recoup in any substantive measures some of this under existing law. So again, gift of public funds is a constitutional prohibition, and that's really the focus on something like this. Not that it would be intended, but the gift doesn't have to be intended to be prohibited.
Okay, thank you, Anita. Supervisor Sabatier, I saw your hand up. Go ahead.
Thank you. I was going to actually speak about Ms. Grant. I think that Ms. Grant has the leniency from this board to just look for a way to solve this problem and not guide her toward the direct way of how to solve the problem, because I think there might be some creative ways, and so I think we just leave it open, and if she finds that ability, then we can discuss it, and if it's not possible, then it's not possible, but I hope we can find a creative way.
Okay. Any more public comment? I don't see any hands up at this point. Jake, can you open up the room?
Yes, I will open up the room here. The floor has been unmuted. If you'd like to make a comment, please start by stating your first and last name.
Okay, Jake, hearing none, we'll go ahead and bring it back to the boardroom. Supervisor Sabatier, is there anyone that'd like to make comment on this item in the boardroom?
It does not look like anybody is looking at me or getting up to make a comment.
Okay, we'll go ahead and bring it back to the board then for action. And I think the action today was talk about to see if this could be looked into. At least I know 3 board members made that comment, if we could look into it and then look to potentially bring it back if it's possible, or if it's not, I think it's an item, we'd at least like looked into. Okay, just confirming, we have a consensus, obviously,
Yes.
from the board members, at least 3. To move
Yes, I
forward.
agree.
So, okay. All right, sounds like we got 5.
Yep.
Okay. All right, Todd, thank you very much. This will be an item that hopefully we will see it again. All right, thank you. Okay, we're going to move to item 5.1. I did see Jonathan Armis come into the room.
Yes,
we'll
he
move
is here, Mr. Chair.
Yep, item 5.1, approved budget transfer for budget unit 2711, Animal Medical Clinic, from account 727.28-30 Special Services to 727.62 to .74 Capital Asset for new capital asset in the amount of $5,396.93 to purchase an animal medical clinic autoclave and authorize the chair to sign.
Mr. Chair, if I could just jump in before Jonathan does. I just wanted to explain this really briefly and do a quick share screen. We attempted to put this into Granicus so you could see it yourself, but because the problem with Granicus today, we could not. So just a very simple correction on the budget transfer form that's before you today. In the version that you have posted, it had the wrong account code. It had 727-6238, which are inventory items. And this situation involves a capital asset. So it's a different account code that you see right there. So that was the reason for pulling this off consent, so we could call the need for correcting that to your board. And then I'll let Jonathan speak more specifically to what this is about.
Thank you.
Okay.
Morning, supervisors. So the autoclave is what we use in our clinic for all of our surgeries. That allows proper sanitation of all of our tools and everything else we use. And our previous one had been limping along for a while, and it finally had given out. So we needed to purchase a second one to replace it so that we could properly do surgeries and have all of our tools disinfected. So that's largely the only thing that we needed it for.
Okay, thank you, Jonathan. Supervisor Sabatier?
I will just say that your agenda item forced me to look up autoclave, and I learned something new. I had no idea. It looks like a big washing machine, dryer, and type of thing for all your utensils that you use for your surgeries. So absolutely necessary to keep doing the work that you're doing.
All right. Any other comments or questions from board members? Okay, hearing none, we'll go ahead and open it up for public comment. Public comment on item 5.1. I don't see any hands up, Jake, so let's open up the room.
I will unmute the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, go ahead and close the Zoom room again, and we'll go ahead and bring it back to the board, to the board chambers. Are there any public comment that would like to be made in the board chambers?
I do not see anybody that wishes to make a comment on this item.
Okay. All right, we'll go ahead and close public comment and bring it back to the board for action.
Mr. Chair, I move to approve budget transfer for Budget Unit 2711, Animal Medical Clinic, from account 727.28-30, Special Services. I hope that's a new number, to 727.62.74, Capital Asset, for new capital asset in the amount of $5,396.93 to purchase an Animal Medical Clinic autoclave, and authorize the chair to sign.
Second.
I was seconded by Supervisor Crandall. Go ahead and we will, there's been a motion and a second. Please do a roll call vote. Johanna? Is Johanna still there?
So sorry, Mr. Chair. Johanna just alerted me that she got dropped momentarily. So I will call for the vote, and we'll start with Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Yes.
And Supervisor Simon.
Yes.
Thank you.
Thank you, Jonathan.
It might be a good moment to take just a short break if your board is needing it. Since our assistant clerk of the board got dropped out of Zoom, she'll be right back.
Okay, let's take a, we'll take a 5-minute break then right now. We'll take a comfort break. We'll take a 5-minute break. We'll come back at 11:07.
This is Stephen Carter, Deputy County Administrative Officer. So before you today is the annual master fee schedule adjustment, which was established in 2017 by your board, where all county fees that we charge are in one place and can be updated either by CPI or some kind of fee study for a new fee or updating a fee. Today, there's quite a few departments because it's an annual update. It is a little late because of the pandemic. Normally we would do this in May, so it would go into effect July 1st. Fees that are not community development specific go into effect the day that it is approved. Community development fees go into effect 60 days later. The fees today would be, the first is with the Ag Department. They're trying to add a few industrial hemp fees, including the county registration fee, pre-site inspection fee. This is to more accurately reflect the work being done by the county, so recuperate our costs. And then the building and safety division is also adding some fees, and those are related to permit extensions where we didn't have fees before. If your permit expired, you would like to go before the permit expires to have extensions. And they have different rates for if it's less than 1 year, or 1 year to 5 years, or 5 years and over. And then there's also environmental health fees being adjusted. Quite a few of environmental healths are being updated by CPI, which was 2.9% this year. We always use the February date, and that's what the actual CPI was year over year, February to February, 2.9% for the Bay Area. And then the next department, I'm scrolling down 1 second, that's a long one, would be planning, but those are fees that are collected by CDD, but actually go to another department. Like Public Works is updating some of their fees that are collected by CDD, but actually charged by Public Works for things like permits and subdivisions, et cetera.
Public Services is updating their solid waste fees to increase by CPI. And we're also adding a cleaning fee for when we rent out one of our buildings, where if it requires an extra cleaning compared to normal, then it's charged for the cleaning crew. Public Works is updating their fees as well. It's mostly by CPI. And they also updated some of the surveyor fees, which is basically just switching it to the current hourly rate of our surveyor to recuperate the actual fees. The Sheriff's Department is also updating their application fee, which is by how many hours it takes and actually hourly rate of the employees involved. Drug testing is being taken off, but being added into the application fee. And then finally, Water Resources is updating their fees by CPI 2.9%. And that's all I have for you today.
So, Mr. Chair, what Stephen just reviewed is Exhibit A in the agenda packet, and the department heads are that represent the departments mentioned are here if you have questions for them.
Right. Jake, I know we got a TV in the background or something. We can get that off. Thank you. Supervisor Sabatier?
Check, check. Hello? There we go.
Yeah, there you go. Yeah, I can hear you now.
So over the weekend, I asked for the entire fee schedule, and I was pleased to see that because it's good to see the CPI increase for everything, not just the others that had a significant change or were new. And there's one section that I'm just really uncomfortable with, and it's really, on one end, it's not a lot of money for us. Maybe it's needed. That part can be explained to me. But on the other end, maybe it's not a lot of money for the person trying to develop something. But I'm looking at the entire increases for food establishments. And right now, our food establishments are hurting with the rules and regulations that are in place. And I think we need to throw them a bone and just keep them at the rate that they were before, not try to increase that. We need to, already if you open up a restaurant, you have a 25% chance of success. It's already low to be successful. And now with everything that we have on top of that, we're going to increase the annual fees. We need to make sure that we can allow for this industry to survive this and be created within this situation, not make it more difficult. And so that's the only one that I'm just not unsure how to navigate through. And if somebody wants to discuss it in greater detail as to why it's needed, like I said, I'm uncomfortable.
Okay, I see Denise Pomeroy has her hand up, so go ahead and go to Denise to answer that question from Supervisor Sabatier. Go ahead, Denise.
Denise, looks like you're unmuted. Are you trying to speak? I don't see a phone symbol on her name.
Okay, we'll try and come back to Denise when she can get through. I know she was able to do that successfully earlier. Supervisor Brown.
So that was one of the things that I was actually going to take a little different approach on. I agree with you on that, but I also know that, it's a self-funded department. We still have to pay our employees. They're still going to be there. They're still going to be performing these functions. And I'm wondering if that is something that we can reimburse them for through the CARES Act funding that we're looking at. Maybe that's a discussion we should have. I don't want to have it right now. I don't think it's right to do that, but I think it's worthy of the discussion that we're going to have maybe next Monday. Because the staff, our departments still have to be made whole for the work that they're doing, and some of them are getting general funds, some of them are self-funded, and this department's self-funded, so I don't think taking funding away from them is going to accomplish anything, but I think helping those that they're actually doing the inspections and typically would bill for those functions, I think we can do both. So the question I have, and if Denise is off, or somebody can answer me this, trying to find it again here. It's on page 1, the hourly rate for property searches. What property searches are we doing? Curious about that. It's a new fee. It's not going to be an increase. It's a new fee. So I'm interested in what that's all about.
So with department heads online, whoever can answer that question or would like to try and answer that question.
So it appears that Denise Pomeroy does not have a microphone, and so we need her to probably join the meeting in another way, like use her cell phone or something so she has audio, but it does not appear she has audio, although I see Jesse King is here. Jesse, can you speak to it?
Good morning, board. It's actually Denise. I ran.
There you go. Thank you.
I'm having some technical difficulties today, so I apologize for that. Yeah, so as a self-funded department, you know, the department's all of its operating cost is covered by our fees to all of our constituents in the field. While we understand that, you know, this is a difficult time for some of these facilities, not all. The majority of these facilities, excluding the mom and pop shops and restaurants, were open the entire time. In addition to that, the EH workload to support this industry has doubled, if not tripled, with the amount of work that we are providing with them throughout the entire emergency and ongoing as they get outbreaks within their facilities. So I respectfully request that the CPI continue for this year to cover our costs.
Supervisor Sabatier?
And I think that's one of the difficulties of a self-funded department is if the cost of the service increases, then typically it gets passed on to the taxpayer. And so I will agree to move forward with the idea that we want to find a way to either provide some new funding to EH to be able to support their increase and not have that passed on, or support those businesses and pass on whatever the increase is to them so we can support them and not seeing an increase. So I will work my best to make sure that it all comes back to evening out and back to what it is currently before the increase, because I get it, it is self-funded, but at the same time, I just, it's in my mind, it's just too easy to say, let's increase it. So let's work on a different alternative, but I will agree to the increase just because it does have to pay for itself, but we can find a different revenue stream to use to help fill it up.
Thank you, Supervisor Sabatier. I do know that Supervisor Brown had a question about property searches, and I don't know, who would like to chime in and try and answer that question directly.
So that would be EH again, and either myself or my team can answer that question. I'm sorry, I didn't hear it. If Supervisor Brown would please repeat it.
There's a new section called property searches for $128. And it goes into, you need how many hours or whatever. I don't know what the relevance of that is as far as the fee goes, but it's a property search. I just want to know what that's about.
Okay, so that is search request for marketing purposes, and it's charged in 15-minute increments. So our hourly rate is there, but it depends upon, sometimes we'll get a request for 20 or 30 searches at a time, and we haven't been charging it, and that takes staff time of about 15 minutes of property search to provide that information.
Okay, what property search? That's what I'm asking for. I'm not.
APNs, homes, septics,
okay.
businesses.
Okay, so you're talking about.
Here, I'm gonna let Kelly,
you're
my office manager.
You're talking about research for data. You're not talking about going out and searching somebody's property.
No, it's data. It's pulling our files and copying files and pulling the records from our electronic system to provide them with the information they're requesting.
Okay, all right. That's Yeah, in my world, a property search is actually going out there and searching a piece of property, not doing.
Yeah, in law, that's much different than what we do in environmental health. I can understand that confusion, yes. That maybe we need to change the word on that, I'm not sure.
And you could refer to it as digital property search, perhaps.
Okay, yeah, well, that's a good idea, Carol. We can make that change.
So if we're going to amend that Exhibit 2, we had hoped to have this on your board agenda for July 21st, and that's the date on it. So that date would also need to change. The effective date of these fees, if you approve them, would actually be August 4th. We intended this to be on your agenda 2 weeks ago, I should say.
So,
Okay.
Can I?
Go ahead, Super.
Okay, so I had one other thing. So this is years ago. You know what happens, and I hope you guys don't have to deal with this. This is the way to resolve it: is where you hold off on any increases at all, and then all of a sudden you got to have a big giant 20-30% increase, and it just hits everybody. So if you have this incremental cost of living or CPI, whatever it is, increase annually, it doesn't hit people hard and they can budget for it. Businesses can budget for it, departments can budget for it and all that. And so this is good, although it takes a lot of work to get it to this point too. So I'd like to see a policy that says this will be done automatically annually at a certain time. And that way you don't have staff, spending hours and hours and hours trying to make money to pay for those hours and hours and hours. So it's just something that's automatic, I think, would be much simpler for you.
So the administrative office really does assume this is automatic. I appreciate your comment. As you probably recall, when I became CAO, your board communicated to me that this was a very high priority. And so we've been doing it annually ever since. And then, as you also know, there are periodic adjustments occasionally at other intervals if there is some need for a new fee or something like that. But as Stephen said in the beginning, our intent is always to get this to you in May so these fees can go into effect with the new fiscal year. But this year we're slower because of the COVID crisis.
Okay, Supervisor Sabatier?
I just wanted to give appreciation seeing the new hemp registration fees and the categories rather than just one specific fee. I know that the Ag Commissioner has been doing a lot of work last year, maybe a little bit less work this year because of the number of applicants, but it's still important that that application fee results in the work that's actually been done. And so I appreciate seeing it here because it was desperately needed.
Okay, thank you very much. Any more comment from the board? Questions? Okay, hearing none, we'll go ahead and open this up to public comment. I see we do have two hands up. Jake?
Yes, so the first hand I see here is from Jesset King. I think that was shared.
That might just be left up, yeah.
Yeah. I'm gonna.
What about the second hand up?
Is that correct?
Yes, that's correct, Jake. It's from before.
Okay, thank you. Just want to make sure. All right, so the second hand we have up here is from Melissa Fulton.
All right, Melissa.
Thank you, Supervisors. Melissa Fulton, CEO of the Lake County Chamber of Commerce. And I need to ask for a clarification. In reference to this item, I thought what I heard was that EH is now spending considerable more time in reference to restaurants than they had previously. And although restaurants, many are continuing to operate, my information and feedback from those businesses is that their revenue is somewhere in the 25, maybe if they're lucky, 30% of what their revenue would be without the virus. So I'd kind of like a clarification about how it is that EH, if what I understand I heard is true, how they are spending more on that effort than they had previously.
I see I have a hand back up. Jazjit, go ahead.
There you go. Hi.
Okay, can we see?
Yeah, it's Denise and Jesse here.
Okay, Denise. All right,
Sorry.
thank you.
So there's a lot of things during the entire, the whole COVID-19 response. EH, we received a significant amount of complaints. EH has to investigate each one of those if it's a food or a FDA retail facility. Helping facilities maneuver through the whole COVID-19 thing and disinfecting and staffing safety and precautions. When they've had outbreaks at a facility, EH assisting them with the guidance on how to safely reopen. I'm gonna turn over here to a ton of additional questions and new owners, more training. The whole COVID-19 thing has put an enormous amount of additional work on our EH staff with all of our programs, but mainly in the FDA retail food industry.
Well,
Yeah,
I appreciate.
who wants to say something?
The major, this is Jesse, Environmental Health. The major challenge was a lot of these food facilities were reaching us for CDPH protocols. They change every week. So how their business is going to affect is every week we have new protocols from CDPH and the different phases when they were closing down or they were opening up. So it was every facility we have to reach and do outreach. That's where we spent a lot of time on outreach and the complaint follow-ups.
All right, I would like to comment on that because as I stated, most of these facilities, if in fact they have been able to remain open, and currently, of course, it's strictly outside service or grab and go, their profit margin, again, they're doing 25% of the business that they normally would be able to do. I appreciate all of the extra effort that the virus is putting upon environmental health, but I would like the supervisors to consider, finding funding to supplement environmental health through this period, of which we have no idea when it's going to end and when we supposedly can get back to what all of us consider normal. But I think that given the challenges that our businesses of all types are facing, trying to maintain some sense of viability and keep themselves alive so that they survive all of this, I think that I would love to find out if the Board of Supervisors can find some funds they can transfer over to environmental health to help them through this and not raise the fees for their, at least, and I don't know if it's easy to define this, but their efforts for restaurants. They are extremely challenged, as is everyone. And I think, because I'm the curious type, I would like to know what environmental health's expenses in reference to restaurants was from January 2019 through July of 2019. So a like period, if you will. And one of the reasons I ask that is because, again, some of the feedback I've had over the years is that environmental health is responsible for periodic checking of restaurants or food facilities, and that in the past, those inspections may not have been as often as they supposedly should be. And that again is hearsay, so I want to clarify that. And so I appreciate your time. And if in fact there could be a comparison for 2019 versus 2020, I think it would be an interesting piece of information. But there again, we're asking for additional staff time. So thank you very much for your patience with my questions and my concerns.
Supervisor Brown.
So that, Melissa, that's what I was suggesting earlier. There's a source of funding that we may be able to have this discussion. Bruno and I are on that committee, and we'll talk about it. We're meeting again next Monday, and that may be something that was what I was saying earlier, that we may be able to tap into for that. I don't think we should not raise it, because we got to keep consistent. And I don't think we're going to be hitting the restaurants. I think we're going to find something, but we don't want to come back, in 5 years and then have them have a bump of 20% because we didn't do this 3% that they may or may not have to pay right now. So, and I do agree with you. I think, the statement was made earlier that, some of the restaurants were open the whole time, or at least for a significant amount of time, but being open and making money is not the same. And unless you're with the government, I think, these businesses were open, begging for people to come in. Their employees weren't there. They had to send them home. They were on unemployment because you don't need waitresses when you're sending, doing just takeout. So I think to just broadly say, the businesses are doing good now and they should be able to pay the fees, I think that's naive, and I don't think that's accurate at all. So I think we do need to consider those businesses that are being impacted by fees that we're imposing. And we have to. They're a self-funded department. We have to have them. They're out there doing things, so we need to do it, but we need to identify sources of funding that won't hit the businesses as hard.
I appreciate those comments, Supervisor Brown.
All right.
I did not mean to indicate that the fees would not be charged on an annual basis, or the increases would not be implemented on an annual basis.
Got it.
I didn't mean that at all. So thank you very much.
Thank you, Melissa. Okay, Supervisor Scott.
My question would be for Denise, looking at the food establishments and the permit fees. You charge the permit fees by the size of the restaurant. Because our restaurants are now outside and the restaurants are smaller, are we looking at some of those restaurants that were larger going down to the smaller than 600 square feet? Or are we evaluating the fact that they're not even using their restaurant space?
Denise, are you still on, or Jaji?
Hi, yes, we're on. I was waiting to be unmuted. So a couple of, to try to answer a couple of your questions, we're happy to run an analysis of our time, the EH, are filling out 214s and all of that relating to their work for COVID-19. So with our annual fee increase, while we greatly appreciate the efforts that the restaurants have been doing, it's still, and when I say minimal, I'm in no disrespect to the restaurants, because anything is not minimal to them, but on a $300 fee, it's $9 for an entire year. And on our highest fee, for one of our higher fees, it's like $25. So the purpose of putting in the CPI helps the self-funded departments stay in line and be able to pay our increases. Just like all businesses, if their costs go up, it gets charged back out to whoever they serve. So, and when I said a lot of the places were open, Supervisor Brown, I was referring to the grocery stores and the gas stations and the facilities that are a big portion of our retail food, not the restaurants. So I wanted just to get that clarification.
All right, Denise, thank you for that clarification.
And Supervisor Scott, I don't think I answered your question, so if I didn't, can you please repeat it for me?
You charge fees by the square feet of the restaurant, and because our restaurants aren't able to use their space inside, are we reevaluating some of those restaurants that are on the larger scale to the smaller scale? Or maybe we should look at something to the fact that they don't have a restaurant, it's only takeout only.
That's a good question. The answer is no, we have not looked at that. The sanitation and the cooking and the heat and the grease traps and all of the sanitation processes that are regulated by the retail food code are still the same. So the process for us, whether they're serving, whether just doing takeout or, outside dining is still the same. The inspections are still the same. The process we go through is still the same. But I'm happy to have a conversation with my staff about it and get back to you.
Thank you, Denise. All right, any more questions from the board? I went back and forth there. So go ahead and open up the Jake, can you open up the room? I don't see any other hands up.
Yes, I will open up the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, go ahead and close the room. Do we have any public comment in the boardroom?
I do not see anybody standing up for a comment in the boardroom.
Okay. All right, we'll go ahead and bring it back to the board for final comments, questions. Supervisor Crandall, did you have a question or?
Yeah, I just had I heard Supervisor Brown say something about possibly using the CARES Act funding, and I seen where it says Public Services is requesting to increase the solid waste tipping fees by CPI. And then later on, like the last, right before last sentence, it talks about COVID-19 sanitizing. I think there's potential for that because they're listing a lot of, they're listing that COVID-19 in there, and CARES Act is usually, helps with CARES Act is usually designated for things like that. So I don't know, we just have to look. I don't know if Denise has got a chance to research that already or not. But.
Yes, we have that. Actually, we'll be bringing something back. Carol, what is the plan for bringing that back what is your hope there, Carol?
Excuse me for just a moment. The question was?
Eddie was suggesting something that we've been talking about on the CARES Act, and rather than have that discussion now, when do we think we'll be bringing that back?
Well, we want to bring it to the board obviously well in advance of final budget. Final budget is too late given how quickly we have to move to expend the funds. The CARES Act funds have to be spent or obviously committed by 12/30. So the likely agenda date is going to be the 25th of August to bring that plan to the board.
So, just to tell, Eddie and the rest of the board, anything that's related to COVID expenditure from any of the departments is on the table at this point. There's a lot of departments that are looking at things. Some of them we can do, some of them we can't, or won't, or we'll bring them back. But that is one of those sanitation issues are one of those.
Okay, we'll look for that at a later date. Thank you, Supervisor Brown, Supervisor Swati, and also Admin. All right, any more questions or comments on the master fee schedule, which we are on right now? If not, we'll go ahead and entertain a motion.
Mr. Chair, I move to approve, or I offer the resolution.
Okay, resolution's been offered.
Okay, Supervisor.
I think we may have lost her again.
I think it was me first.
Yeah.
Johanna, are you still there?
I think we lost her. Sound like she got cut off.
Okay, I'll go ahead and do it then, Mr. Chair. So Supervisor Sabatier is an aye.
Yes.
Supervisor Crandall?
Yes.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
I didn't hear Supervisor Brown.
I said yes, sorry.
And then Supervisor Simon?
Yes.
Thank you.
All right, thank you very much. We'll move to our 6.4 item, our 10 a.m. item. Consideration of a resolution authorizing a joint application by the County of Lake and Adventist Health through California Department of Housing and Community Development Home Key Grant Program. And this will be brought up by Social Services. So go ahead. Do we have the folks in the room, Carol?
Crystal was here earlier. I believe I saw her earlier, but yeah, she's here. Crystal,
Okay.
Are you having trouble unmuting?
I just really sent her an unmute request.
Can you hear me?
We can.
Yes.
Okay. Good morning, Chairperson Simon and board members. This is Crystal Marketan, Director for Social Services. Today, we are bringing before you a request to support an application, a joint application by the County Department of Social Services and Adventist Health for a California Department of Housing and Community Development Home Key Grant Program. This is CARES Act funding, and it's a follow-up to Project Room Key. And I know all of you are aware of the Room Key program we ran for a while. So basically, this funding is available now through the state. There's $550 million to be spent in a really short period of time. So this application has a really short turnaround time. And what we have decided to apply for is funding to help complete the build out of Hope Center in Clear Lake, which is a 20-bed facility, a low barrier transitional housing center that will offer housing navigation and wraparound services to homeless individuals in Lake County. This program Hope Center has already been supported financially by Adventist Health and also the city of Clear Lake. So we would, the money that we'd be applying for would complete a process that's already been underway for some time. And in order to use the CARES Act funding, we would be prioritizing those homeless individuals who are at high risk of exposure to COVID. Let's see what. So I already mentioned that there are 20 beds, and the whole structure of the Hope Center is to provide supportive housing and wraparound services to move people on for long-term housing. And while that is the goal, that will initially also be the goal for the people that we would seek to shelter there. The other thing that this will do is help us to maintain the variance required under the county's plan with the state for COVID response. Would add to the 28 beds that are available at the Elijah House, adding another 20. And I also have present today Shannon Kimball Oth, who is the primary writer for this application, and Tina Scott has also been instrumentally involved in this. It is part of a Hope Rising initiative, and most of you are aware of Hope Rising, I think all of you. It's a collaborative effort in the county to really turn around health outcomes in the county, and homelessness is one of the 3 areas that we are currently targeting for improvement. And we're asking you today to approve the resolution for the application of the grant.
Okay, thank you very much, Crystal. Supervisor Sabatier?
I was wondering if Director Marketan can repeat herself on the Elijah House and the Hope Center, because right now the way that we signed the approval of the Elijah House is that it's temporary until Hope Center, which I expressed myself on my disappointment of that. But at the same time, you're saying that we will have an additional 20 beds when right now the plan is to move those beds. And so I just want to, if you can repeat yourself so I'm clear on what your statement was.
Sure. So I have heard that as well. That is not the plan. The plan is to add the 20 beds to the 28. I think Pastor Shannon has her hand raised right now, and she can tell you the number of beds that we need to maintain the variance.
Okay.
Your mic.
Pastor Shannon, can you hear us?
Hear you. Oh, there we go.
There we go. Okay.
Okay. So it was said in the conversation regarding Elijah House that it was a temporary COVID shelter until Hope Center opens, but there was no agreement with Hope Center or any plan to how to move clients from one to the other. Elijah House is looking also for a permanent facility to operate. It is the priority of the continuum of care for the homeless in Lake County that we look for a two-site solution, not putting the burden of operating a homeless shelter on any one community. So the ideal is certainly to have a two-site solution. Whether or not that is the juvenile hall is a completely different conversation from Hope Center. The variance requires 15% of your pit count. Our pit count showed that on the particular day and where we did the count, we had 572 people who were experiencing street homelessness in Lake County. 15% of that is 85. So for us to be in complete compliance with the terms of the variance as it's come down from the governor's office to remain an open county and all that infers, we need 85 beds. When we add the 20 for Hope Center and the 28 from the temporary COVID shelter that is being operated by Elijah House, we can also look at some of the other homeless and housing programs that are providing beds, such as Project Restoration or The Nest. There are a variety of programs, but this particular grant, this Home Key grant, isn't looking to fund all of those various, but specifically Hope Center, which is currently underfunded to be able to open this fall as originally planned. I don't know if that clarifies it enough, Bruno, to answer your question.
I mean, I have other questions about this as well, but I still think that because of the agreement we signed, I feel in limbo with what was approved last week. And I definitely made my statements last week, but right now it just, I'm unsure. I think we're going to need to resolve some of those conflicting statements sooner than later to make sure that we stay within our local variance of what is anticipated of us to have as far as beds for the homeless. So I'm okay to move on from that, but I still think that it's somewhat in a gray area rather than it's very written in black and white for us to know what's going to happen. So I am going to move on. So it says here not to exceed $6 million. And we are partnering up with, we're not partnering up with Hope Rising, we're partnering up with Adventist Health. Do just want to put a quick plug out there. I know that I've been working with Adventist Health for the past 6 years, maybe more. The amount of work that they're doing to try to offer these services to the community is tremendous. It makes an impact. I know Project Restoration is a gem in our community as far as showing what we can do to change lives, and so I really appreciate seeing their efforts, and I'm just going to put out the challenge that I'd love to see others step up to that same plate that Adventist Health has stepped up to. My one thing is that's a lot of money for Hope Center. is it limited only to Hope Center? Because when I read through Home Key, in my opinion, seemed to be more along the lines of purchasing properties that were dilapidated, using that money to rehabilitate those properties, and then allow those properties to be used to create homes for the homeless. And I'm not seeing this here, and our community can really use some rehabilitation of some of our housing. And so I'm wondering if all of it's going to be used for Hope Center. I don't see necessarily a breakdown of the $6 million either. And so I'm just kind of looking to see what else comes along with this other than just providing money towards Hope Center.
Crystal, would you like me to speak to that, or would you?
Go ahead.
Okay, so first, just a point of clarification, Adventist Health is the co-applicant, but we are partnering with Hope Rising. So the applicant is Department of Social Services, Adventist Health is the co-applicant, but Hope Rising is also a partner, just for clarity.
Okay.
And then you're correct, Supervisor, that there is an allowance to purchase dilapidated properties within the home key funding, and that is a part of the intent. However, for this particular tier of funding, tier 1 funding, you have to be in a position to get your project up and running, occupied within 90 days. And Hope Center is in a position to be able to do that if we can receive the funds to finish the construction, to furnish the building, and then to provide operating staff during COVID, that initial outtake. And then the other piece of it is that Hope Center is not only an emergency shelter as the COVID shelter is, but is requiring, as part of the Home Key grant, would have a full-time housing navigator. And that is a person who is specifically not just doing casework with clients, but moving them into permanent housing. So it is all of those things. And I do believe that we are talking about in tier 2, when we don't have this 90-day occupancy requirement, to look at how we can support permanent supportive housing or permanent housing purchasing properties as well.
Okay.
So
I would like to add also, this is Crystal again, that we were required to have a technical assistance phone call with the state, and they did agree that our application was an approved use of the funding.
Right. No, I appreciate that. And I definitely wasn't questioning the use of the funding, just looking at the whole of the program, and I wasn't aware of the tier 1, tier 2. And I sure hope that we can work on maybe starting to identify some of the potential houses that we might be able to rehabilitate, and maybe even working with the tax collector's office on tax defaulted properties that can be direct saled for that program might be an easy way to get that started as well. So I look forward to that coming to us, and I'm good to go.
Okay. Supervisor Scott?
I would just like to add, I was actually on that phone call with the state, the pre-application phone call, and I'll have to say they were quite impressed with Lake County, of how organized we were, who we had on the phone call, and the project. They were impressed of where we were with it and where we were going. They couldn't say anything but great things about that. So we all really left that phone call just really excited about ourselves and where we're going and where we have come from. I also like to add, with our variants, I believe that the people that we have housed through the COVID Emergency Center, which I believe is 22 people, can also be included in those numbers for our variants of beds, because we have successfully housed those off the street. So we can use that number. I believe it's 22.
Nice.
Okay, thank you very much. All right, any more questions from the board? All right, we're going to open it up to public comment on this item. Jake, I don't see any hands up. Can you open up the room, please?
Yes, I will open up the room here. The floor has been unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, here none, go ahead and we'll close up the room, the virtual room, and we'll bring it back to the actual boardroom. Are there anyone like to make comment in the board chambers?
Yes, we have an individual who would like to make a comment.
Okay. Please state your first and last name.
Joan Moss. I would like to know where the homeless people were moved on July 31st. And I would like to know how this relates to what the supervisors voted last week, which was to move them to juvenile hall, the old juvenile hall. Where are they right now? And I understood that what happened last week was that there was going to be the old juvenile hall renovated and the homeless would move there. And now this is another 20 beds in the city of Clear Lake. Please explain.
I see Pastor Shannon has her hand up. Pastor Shannon.
Yes, thank you for that question, Joan. I do want to clarify that the people experiencing homelessness that were moved on July 31st were 28 people. We have 572 people experiencing homelessness in Lake County right now. So I just want to say that it was one group, and they were, in fact, those that wished to transfer to Elijah House. Elijah House is the organization that is operating our emergency COVID shelter out of the juvenile hall facility. So that is the specific answer to those that were in Lakeport. And then the Hope Center is a completely different project, although we do anticipate having partnerships and supporting and providing advocacy across the projects.
Thank you very much for those clarifying statements. I cannot see, do we have any other public comment in the board chambers?
No further public comments.
Okay, we'll go ahead and close down public comment, bring it back to the board for action.
I'd like to offer the resolution.
Can I just
Resolution has been offered.
May I make a quick
yes,
comment?
Supervisor Sabatier.
I just want to thank Director Marketan. I know that we received an email saying that it was possible that we can get access to this grant, but we weren't 100% sure. So I appreciate the fact that she obviously went through the hoops to try and figure out what was accessible, what was not accessible, and to bring this back to us, because I think every little bit that we can do to move our communities forward is helpful, and I appreciate this being on our agenda.
Okay, thank you. The resolution has been offered.
Okay, can you hear me?
Yes.
Okay, Supervisor Sabatier,
Aye.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Brown,
Yes.
and Supervisor Simon.
Yes.
Thank you.
All right, thank you very much. I'm going to take a quick 5-minute break, and we will be back here at 12:05.
Convene? We are ready to move.
Thumbs up. Thank you very much. Excellent. Okay, we're going to move to our next timed item, which is our 10:30 a.m. item, our 6.5 a.m. item. I know Supervisor Crandall at the beginning of the meeting asked to have this item pulled, and I don't know if you had a comment, Supervisor Crandall, but you asked to have it pulled.
Yeah, so I decided to pull this. There was just some confusion on whether it's an urgency ordinance or a non-urgency ordinance. Also, it was posted without the COVID. It was posted without the Blue Collar Committee's ordinance initially, and as I referred people over the weekend to, they didn't see it posted, and so it also the urgency ordinance was conducted by staff and recommended by COVID Recovery. And vice versa, the blue collar worked on a non-urgency. So there's just some confusion. Rather than having all the confusion, I'd rather pull it till either next week or later after, and make sure it's crystal clear on what's what, and go forward from there.
Thank you very much, Supervisor Crandall. Just wanted to clarify, too, at the beginning of the meeting, obviously there's an item that was going to be pulled by Supervisor Crandall. He's the one to put it on the board. And I do know that we have people in the audience that were here to comment on this item, but it is being pulled. At that time, we talked about potentially if someone wanted me to comment one way or the other on the item being pulled, that is the strict comment that we have, talk about. We're not going to talk about the ordinance or other things. We're going to keep it on track as far as the item just being pulled and requested by Supervisor Crandall. And so if we have any comment, that's how we're going to move forward on just commenting on the item being pulled. Specifically. Okay. Supervisor Sabatier?
Okay, we have a few people here who would like to make a comment, and so go ahead and come first to the podium.
Thank you. I realize I am not to say if I am in support or not of this ordinance, but I'm disappointed that we are putting off the vote again. I support our local public health department, especially Dr. Pace and our supervisors, in doing what's best for Lake County in discussing and voting on the COVID-19 urgency ordinance. Lake County does not want to end up on the governor's watch list, which would mean loss of local control, schools not opening, and closures of business. It is obvious how to vote and to keep our positive numbers down, and how to vote so we will remain off the governor's watch list. Thank you. I'm Paula Mooney.
Thank you, Paula.
Thank you for cleaning up.
Certainly. Go ahead.
Good morning, Supervisors. Thank you for the chance to speak. My name is Haji Wharf, and I come to you from Upper Lake. My reason for being here today was to show support for the proposed urgency ordinance. Had it passed, I would have volunteered with the Public Health Department to promote compliance and encourage others to do the same. So just as you reconsider the issue, once again, that's something to bear in mind. There are an army of us, I'm pretty sure, that will volunteer despite the risks to our personal safety to help educate and encourage compliance, should it come to that. We as a community need to step up and stand together in this monumental fight to thwart the invisible invader known as the coronavirus. And Lake County currently enjoys more freedom and latitude than all the counties surrounding us, simply because we're not yet on the state's monitoring list. But that might be just a matter of time if we keep putting off, addressing the issue of noncompliance. And in order to avoid the fate of even more burdensome restrictions, we as a community must compel compliance with health orders. This will not happen without everyone's cooperation. Each and every one of us needs to unite in this mission. Let's make sure my 83-year-old mother, your frail and elderly neighbor, and your friend's 8-year-old daughter with leukemia has the best chance of avoiding the virus. Let's make sure our local businesses, already stressed by current conditions, aren't delivered additional blows from more regulations that come with being on the state's monitoring list. Some in Lake County say they're exercising their freedom by not wearing a mask. Well, to me, freedom doesn't mean only rights. It also means responsibilities. When I wear a mask in public or decline an invitation to a gathering or remain inside my home, I want you to know that I am aware that I could be asymptomatic and still transmit the virus. And no, I don't live in fear. I just want to be part of the solution, not the problem. I don't feel controlled by the government. I feel like I'm being a contributing adult in society, and through my example, hope to encourage others to do the same. Wearing a mask doesn't mean I'm weak, scared, ill-informed, or controlled. It means I'm being considerate of those around me. Wearing a mask is not a political statement. It's a public health choice. I hope that you will reconsider on this ordinance, whether it's non-urgent or urgent. I consider it urgent, but please continue to do what's in the interest of Lake County. Okay? Thank you.
Thank you.
I would just like to, my name is Amy Crook. I am a constituent of EJ Crandall, and I am extremely disappointed, wasting my time again. So the next time you put this on the agenda, please be the leader that we voted for and actually have things prepared and ready to go. I'm tired of my time being wasted. Thank you.
We have any more comment in the boardroom?
It does not appear that anybody else has a comment from the public.
Okay, we do have 3 hands up. We'll go through those 3 hands. Jake?
All right, the first hand we have up here is from Melissa Fulton.
Yes, I'm asking for clarification. We've had 2 different versions of an ordinance, and I just want to be clear that when Supervisor Crandall talks about bringing back this ordinance, that we are talking about the ordinance that was drafted by the Blue Collar Committee for consideration the next time it's on the agenda, or are we talking about an ordinance that was crafted by county staff?
And that was
appreciate. Go ahead, EJ.
That was the confusion, and that's why I'm pulling it, because there's 2 different versions, and there needs to be clarification as to which one's which.
So is it possible then that when the ordinance comes back, that you'll actually have 2 ordinances under consideration for discussion at that time? Or will it be one or the other?
I think it'll be both. I'm pretty sure that's the intent. That's the whole intent why I pulled it as well.
Thank you.
Okay, next hand up. Jake?
The next hand we have up is from Dee Parker.
Hi, good afternoon. Supervisors, thank you so much for doing this. I do appreciate it being pulled. It gives more people opportunity to look at both options. And I'm asking, I see under the agenda, there are multiple attachments to this. Are all the attachments under the agenda available to look at that are going to be proposed the next time it comes around? Number one, that's what I'd like to know. The second question is, the Blue Collar Committee, where do I go to find out how this was formed, how people were elected and or appointed to it? And that would be a question. So I appreciate the time and energy that's been put into all of this so far. I appreciate everybody's passion, either side. I just want to make sure that there is enough information available prior to the next submission so that it can be addressed equitably. So if you could help me with that, I would so much appreciate it.
All right. Thank you very much. Supervisor Brown?
So I can answer the question about the Blue Collar Committee. It's not a board-sanctioned committee. It's not a board-appointed, board-elected. It was something that I did on my own earlier on in the when the shutdown occurred. As a business owner myself, I contacted several business owners from different segments of the business population and different industries, and asked them to join me in trying to come up with solutions on keeping our businesses going in Lake County. It's not a It's not sanctioned by the board. I invited Eddie to be on it as well. He represents hotels, restaurants, and the casinos, and he works in that, with the tribe and several other businesses as well, Chamber of Commerce, and that's how that was formed.
Thank you, Supervisor Brown. As far as the information on the agenda item and everything, that all should be available, on our website through the agenda stuff. So I'm going to take those attachments. If you have some more questions or anything, Dee, you can contact me and I can help you also.
Oh, thank you so much, Moak. I will do that and not take up any more of your time. Thank you so much, gentlemen.
Thank you. I see our next hand up is Michael Green.
Yes, Michael Green, I've sent you a unmute request. Great. Will you please confirm your first and last name?
Yeah, Michael Green, just thank you. Very quickly, it is disappointing that this item didn't move forward. The idea that it had to be vetted by a blue collar committee that was just admitted is not an official government thing. So I don't know why the committee gets to vet stuff any sooner than the rest of the general public does. So it's kind of disappointing that we're dealing with two committees on top of a board meeting that meets virtually now. So it is difficult for the general public to tune in, figure out when it's time and appropriate to tune in. And you can't please all people. I realize that, but I think by delaying action on it today, I think the greater harm is done to the public than any vetting that might have been done by a committee. I think part of the confusion with today is language. When we use the word poll, I think what you're trying to do today with this item is table it or bring it back for future discussion. You didn't pull it like you did consent agenda items for separate discussion. Your intent when you pulled this item was to basically take no action on it today. So I think being clearer about that at the start of the meeting might have softened the blow for some of those that were hoping to stick around. When you do bring this back, I'll just share that a lot of the general concerns have to do with the constitutionality of it. I don't buy into those concerns, but I do think whatever enforcement process you bring back, you should double down on all the whereases to make sure all the legal justification is in there. And although code enforcement would have had it baked in, the idea that you could have a property inspection warrant process, since code enforcement's been removed from the latest draft and you're going with public health, I think everyone would be assured about the constitutionality of these actions if you addressed a property inspections and included a process as allowed in the civil code for property inspection warrants if warranted. Thank you.
Thank you, Michael Green. Any other comment, public comment?
I want to weigh in on that.
Just on the polling of the item. Supervisor Brown.
So just to clarify for Mr. Green again, the Blue Collar Committee is not a board sanctioned committee, but the ordinance that was presented originally was actually presented by the Blue Collar Committee. They're the ones that formed it. They're the ones that did all the work to do it. It wasn't any county staff that was putting this ordinance together. It came from that committee. It wouldn't have been an ordinance without that. This ordinance that was presented in the agenda is not that same ordinance. It was presented as it was to come from the Blue Collar Committee, but it wasn't. Somewhere there was some confusion, and I think that's why Supervisor Crandall may have pulled it in order to compare the two. So nobody's vetting anything. They're the ones that made it. So the public's going to be vetting it. The board's going to be vetting it. The Blue Collar Committee's not vetting it. They're the ones that introduced it to begin with. You're welcome.
Thank you for that clarification, Supervisor Brown. Okay, Supervisor Scott.
I just like to make a comment that that I do definitely see this as an urgent matter that we need to put in place, this urgency ordinance. So if it's not being heard today, I would really like for a date certain that it will be brought back next week.
Obviously any board member can put an agenda item on. I know Supervisor Crandall asked to have it pulled, and That's what he's working on.
If
I
supervisors,
see we still have two hands up. Jake, can you go to the last two hands, and then we'll close public input and public comment?
Yeah, we have a hand up again from Michael Green. Michael, I've sent you a unmute request. Okay.
So just for clarification, my clarification and the public's clarification, the Blue Collar Committee is not an elected or appointed thing, and yet you are drafting legislation and proposing it to the board. Does that mean everyone out there, we should be drafting our own ordinances and we're going to get equal time to throw things at the board? My thought was that the county was going to be proposing its own legislation, and that's what we're going to be talking about today. If we're bringing competing ordinances back from multiple committees, that's a different type of procedural problem that probably needs to be addressed. But who's writing the ordinances here?
if you wanted to create one, you're welcome to. You could put one together. That'd be a novel thought for you to actually put the work into it.
Yeah, Supervisor Crandall?
Yes, Michael, there were supposed to be two presented, but one wasn't posted. All that's happening is because one was promoted by the Blue Collar Committee, one was promoted by the COVID Recovery Group, we're trying to come together and have both. What you're saying is not similar to what happened, and then it was posted after the fact, so others weren't understanding which one was which. Trying to get better clarification as to that is all that's happening.
All right, thank you. All right, I see we still have a hand up from Dee Parker.
Thank you so much. Just a couple more questions. So, Moak, I will be able to get both ordinances in their entirety from you if I email you. Number one. Number two, so we have one coming from the COVID Recovery Group. I'm not sure who they are. For a second there, I thought you said that the county had put one together. Maybe that's who they are. And then I understand who the Blue Collar folks are. Do we know, are we allowed to know who the inputters are? And then the other thing is, it's critical to me that I find the gate or the notification system that says, hey, this is going on the agenda on this date, and I have more than 24 hours or 48 hours. So maybe I'm just in the dark and uneducated about how the process works and what I need to do to keep up with that so that I have more time to review and mull over. If you could help me with that.
Mr. Chair, I can speak to that. I'm the clerk of the board.
Go ahead.
So our agendas are posted more than 72 hours in advance. You can find them online if you go to the County of Lake website. So all agenda items are posted well ahead, and that's where you can access all the documents for each agenda item.
Okay, so, and in this case, one was missing. So I look at your website.
Ma'am, it was missing, but it was added on Friday night. So,
okay.
So it was still there 72 hours, more than 72 hours ahead.
Okay, so if I'm looking at your agenda items now on the website, when will this item be added to a date there? Do I start watching tomorrow morning?
No, ma'am. The agendas are posted at least 72 hours in advance. In the COVID crisis, we've typically been posting our agendas on Fridays for the following Tuesday.
Oh, that's what I need to know.
Yes.
All right.
Prior to the crisis, we were posting somewhat earlier, but there's more to do, unfortunately, to get the agendas ready in light of these circumstances.
Okay, right. Gotcha.
So it would be posted, sometime on the Friday before whatever Tuesday the board wishes to bring this back.
Okay.
Thank you so much.
All right, thank you, Dee.
You're welcome.
All right, seeing no more hands up.
I do want to answer her. I do want to answer her other question. If Dee wants to contact me, go ahead.
Go ahead, Rob.
If Ms. Parker wants to contact me, she asked who the people were having the input. I don't have the list in front of me, but I can fill her in on that if she wants to contact me. And I don't, there's a lot of work that's put in by a lot of these folks, and it's not just one meeting week or anything like that. These folks are putting in a lot of time, their money, their everything they have into the survival of businesses in Lake County. So to minimize their input, and it's a broad spectrum of people that want more regulation, people that want less. It's a, you know, I included a lot of people in there with broad considerations of where we are with all of this. And so, you know, to have somebody, you know, sit in their basement and Zoom criticize what goes on, you know, with the rest of the world is, you know, it does cause me a little frustration. So that is, you know, I appreciate the work that all these folks are doing. And Eddie, I think Eddie will join me in that. You know, these folks are very thoughtful, and they don't always agree on stuff. It'd be really easy for me to stack a committee with as many people as possible that agreed exactly with me, but I never felt that was productive. And I think you want a lot of you know, a varied viewpoint on all of these issues that are very important to us. And so that's why we've included some people in there that are coming from a lot of different perspectives. And so I think they deserve more than to have somebody like Michael Green sitting armchair quarterback what we're doing over there. So.
Okay. All right, thank you, Supervisor Brown. We closed the public comment and brought it back to the board. This is still, you know, Eddie Crandall was asked to have this item pulled, and that's, you know, a direction we're moving. Supervisor Spatier?
I want to ask, because I think really the decision should be on Supervisor Crandall because he put it on the agenda, but I have no issues moving forward and having the conversation. Everything was posted in time. Maybe there was some confusion, but everything was there. People have spent the time to be here, to wait to discuss this. As far as I'm concerned, I'm very comfortable with moving forward with the conversation. And if Ms. Grant says otherwise because we did something wrong, but I don't think that we did anything wrong other than potentially have a little bit of confusion in the memo versus what the attachments were. But at the same time, we all had the availability to read through all of the attachments and come up with our own opinions on these attachments, and that's what we're here for, to discuss those things. So I'm ready to, because if it's truly an urgency ordinance, waiting till next Tuesday tells me it's not an urgency. And so either we do it now or we do it on Thursday with a 24-hour notice of an emergency meeting, but or a special meeting. But if it's a truly an urgency ordinance that we're looking at because it's needed, then I think we checked off all the boxes to say that we can have this conversation today.
Yeah, what we're talking about, Supervisor Crandall was asked to have this item pulled. You know, Supervisor Crandall, go ahead.
Yes, Bruno, the reason why is because the Blue Collar Committee thought it was a non-urgency ordinance, and then it was posted as otherwise. And so I just don't feel comfortable pushing forward with something where there's two different thoughts or opinions. And not only that, there wasn't enough time for a lot of folks on either side to understand that one was promoted by them and that there was enough time to inspect. That's why I'm asking for an additional week, and I'm still kind of in that mindset. So
okay, I told you it's up to you.
I would also say that it was announced at the beginning that the item was going to be pulled, so now there'd be a great deal more confusion if it was, okay, now we're going to hear it. I think your board's on a path that now you need to move forward with. And the truth is there have been multiple ordinances drafted in one form or another surrounding this issue. So it may be advisable for your board to have some real clarity, not as to author, but as to content and what you believe is going to work best for Lake County. And I'm sure that Supervisor Crandall will give you that opportunity shortly.
Okay. Thank you. Okay.
Right, and that just to add on to that, thank you, Anita, but also to add on to what Supervisor Brown was saying, the group has had discussions, and I'm talking about the Blue Collar Committee, has had discussions about this and went back and forth. And they do understand a lot of different aspects to having an ordinance in place. And so I'll just state that has been discussed before.
All right, thank you very much, Supervisor Crandall. This item has been asked to be pulled, as we'll be moving forward with the agenda. It has been pulled from the agenda. With closing of public comment, bring it back to the board for the comments. We're going to go ahead and move forward with our item 6.6, our 11 a.m. item. And this is the second reading. What I would like to do too is just talk about our path moving forward. What I'd like to do is address this 11 a.m. item. When it's completed, we'll go ahead and take a 1-hour lunch, and we'll come back and complete the rest of the agenda after that. So we're going to go ahead and move forward with our 6.6 item. 11 a.m. item, second reading, consideration of an ordinance establishing regulations and development standards for the Gwinnett Valley District or GVD District.
Good afternoon, Chairman Simon and Board of Supervisor members. This is Scott DeLeon, Interim Community Development Director. What you have before you today is the second reading of an ordinance that your board approved in the July 21st board meeting for the Gwinnett Valley project. As you recall, on the 21st, you had a number of different votes. You approved a number of things to include an ordinance that established the regulations and development standards for a zoning district called the Gwinnett Valley Zoning District. Inadvertently, following the meeting on the 21st, for your meeting last week, all of the documents that were included in the 21st meeting were transferred over to your board's agenda for last week's meeting. And really the only thing that you needed a second review of was that ordinance establishing the zoning district. So the reason why the item was pulled last week was because you took action on virtually all of those items. You approved all of them, and they did not need to come back to your board. So today, what we've done is we've corrected that. The only thing that you have before you is the ordinance, and which requires a second reading. And so that's what we are asking you to do. And I'll be happy to try to answer any other questions.
Thank you, Scott. Greatly appreciate that clarification. Are there any questions from the board at this time? It doesn't seem like there's any questions or clarification questions from the board. Seen any hands up? Okay. I see that we do have some folks from the mall group. What I'm going to do is go ahead and open up for public comment. All right, don't see any hands up at this time. Jake, can you open the room?
Yes, I will open up the floor here. The floor has been unmuted. If you'd like to make a comment, please state your first and last name.
Okay, thank you. We'll go ahead and close the room up, and we'll bring it back to our board chambers for public comment.
We do have a public comment for this item. Come up.
John Moss, I did attend July 21st. I did read most of the things that you discussed. I also looked up the Attorney General's letter. And the Attorney General said that the guidelines do not adequately address the danger of the fire in light of the increased population. It also said that the evacuation site is inadequate. There's only one road in and one road out. And I also wanted to know how I can find the 100 pages that was submitted to you the night before the open hearing last week. There were 100 pages submitted by CAL FIRE, and I tried to find where I can read those, and I could not. I also have looked it over, and I want to know where it gives specific guidelines for identifying the water source for this project. I realized there was dialogue going on between the county council and Rob Brown, but it was very confusing, and I'd like it written out. Thank you. This is Joan Moss. I still think that, given the fact that where I live, they're already drilling for water because they've lost their water source below us. I don't think we're addressing the need for caution as to whether we have enough water for this huge project. Thank you.
And just as a point of clarification, I don't believe that was 100 pages from CAL FIRE. I believe that was 100 pages from the Center for Biodiversity, CBD.
Okay, so you misspoke. Where can I read that?
I would say check with admin. I don't know.
Planning, too.
Planning.
Supervisor Sabatier, this is Director De Leon. That document's included in the online in Granicus. If you go to the agenda for July 21st, it's the very last attachment, and it's a 135-page letter from the Center for Biological Diversity.
Okay. Well, thank you. I will read this, and I think we need to be cognizant that not only do we have a virus pandemic, we have high-risk fire danger. And I think we need to be very careful of that water source. Thank you.
All right, do we have any other public comments on this item? So we did have 2 hands up that just came up in the room. We'll go ahead and, Jake, if we go through those 2.
The first hand we have up is from Kirsty Shelton. Kirsty, I've sent you a request.
Go ahead, Kirsty.
Good morning. Can you hear me okay?
Yes.
Okay, great. I just wanted to respond to Ms. Moss's public comment. And in addition to the public documents that she referenced from the Center for Biological Diversity, on behalf of the applicant team, we submitted many documents, further information in response to the Attorney General in regards to the fire improvements that we were making, and just a lot of clarification. So I encourage her to review that. We believe that the Attorney General was very pleased with the outcome, and we were very pleased with them bringing up some additional information. So I did want to direct that we did respond in writing to those concerns. And then in addition, the water supply assessment for the water use proves that it's sustainable and in reliance. I'm happy to answer any other questions that you might have.
Mr. Chair?
Yes, Anita.
The questions or comments should again be directed to the ordinance that's before the board. Project's already been decided.
Okay. That's just a clarification point from County Council, obviously. As we move through these last comments today, what we're addressing is the ordinance, and we're going to go ahead and move to our next commenter on this item. Jake?
Yes, I'm sorry.
It seems like there's 2 hands up there. Once we're done with these 2, we'll go ahead and close public comment and bring it back to the board.
Okay, yes, so Kirsty Shelton just spoke. Kirsty, I sent you a meet request. Would you like to speak again?
No, I apologize. You can remove my hand.
Okay. All right, then the next hand we have up is from Dee Parker.
Hi, thank you so much. I respectfully understand this has been decided, but I do have a question for Supervisor Brown and Moak. Are you both happy or satisfied with the final outcome of the decision regarding the water that could impact Middletown?
You know,
Okay, that's outside the,
yeah,
Is that inappropriate? I do apologize, no disrespect
yeah,
meant to
it's
that.
already been decided today. We're talking about the ordinance establishing regulations and development standards for the Gwinnett Valley zoning.
Oh, sorry, I
district or
lost that.
GBD
Okay.
district. Yeah, and ultimately, if you go back to the July 21st meeting, I think you can get the answers when you look up this specific item.
And so if this is already decided and everything's done, what is, and this ordinance today, what's the next step?
I guess that would be community development can answer that, but they have what they need to move forward, from my understanding. So go ahead. Don't know, Scott, if you had a.
Yeah, sure. Well, the next step would be the submittal of improvement drawings for grading and other work that they would do. We just recently received a preliminary set of grading plans. And so that would be the next step, would be the submittal of improvement plans.
Yep. Okay. All right, seeing no more public comment, we'll go ahead and bring it back to the board. And I know it's gone through.
Mr. Chair, the action here then would be to offer the ordinance.
Yeah, so I will go ahead and relinquish the gavel to Vice Chair Sabatier, and I will, if that's okay, Vice Chair?
Yes, and I will be looking for action.
All right, and Mr. Chair, I will I will offer the ordinance.
The ordinance has been offered. Can we get a roll call, please?
Yes. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Yes.
Supervisor Scott?
Aye.
Supervisor Brown?
No.
And Supervisor Simon?
Yes.
Thank you.
Motion passes. I relinquish the chair back to you, Mr. Chair.
Thank you very much, Vice Chair Sabatier. Moving on this, before we started this item, obviously I talked about a lunch break. I would just like to get the feeling of the board if we think we could power through these last three items, or would we like to take a lunch break?
So,
Well, since I already ordered online,
Okay.
to save time.
You already ordered it online?
Yeah.
And
Okay.
I will say, Mr. Chair, there were a few individuals that were here to speak on one of the items that we still haven't gotten to, and if they're not available, then I would prefer that we take that break to make sure that they're available.
Okay, I just wanted to confirm with everybody. So we will reconvene at let's say 1:45. We'll reconvene our meeting at 1:45, and we'll finish up the remainder of our agenda. We're going to take a lunch break for all that are on Zoom and others, and we will see you at 1:45 p.m.
All right, see you then. Thank you.
Okay.
Hear me? Ah, there we go. Yes, we're good to go. 1, 2, 3, go.
I have got 1:46 p.m. We said we'd come back at 1:45. Are we good to go in the Sam?
Mr. Chair, I'm hearing that Granicus audio is back up for what it's worth. It wasn't up earlier today, but,
Okay.
and I'll let the team report to you on Facebook and Zoom. Are we good to go, guys?
The room down there is still muted. But it looks like they might be back now.
Oh, the boardroom. Okay, so we need to get the boardroom going. And Sam, are we good on Facebook?
We are now it's almost there.
Sam, you're inaudible. Are we good on Facebook?
We're live on Facebook is what I just heard him say.
And you have your audio, sir. So I think we're good.
Okay.
Mr. Chair.
All right, we're going to go ahead and reconvene the August 4th, 2020 Board of Supervisors meeting. We're going to go ahead and start right back out with our calendar. And on our calendar, we are on item, we're going to go to item 7.2. which is consideration of an ordinance amending Articles 27 and 68 of Chapter 21 of the Lake County Code to clarify the definition of public lands in regard to commercial cannabis cultivation. All right, we're going to go ahead and move right along. Supervisor Sabatier?
Oh, I didn't even realize I had my name on this.
Yeah.
So thank you very much. So this was an issue that was brought up to my attention. I've been working with Scott DeLeon, Director DeLeon from Community Development Department to try and figure out what's going on. It was one of those things that it was, I'm just going to say it was a failure on my part at least to not notice it. But in the last iteration of the ordinance that we passed on May 21st, 2019, public lands was given a 1,000-foot setback. It was never discussed in our informal ordinance discussion before the ordinance was created. It was not discussed during the formal discussions of the ordinance once it was created. So granted, we're supposed to read every word of the things that we pass, and it did not put up a red flag for me at the time. And as I'm sure Director DeLeon, if he's on, can vouch for, it's created a lot of problems for specific sites. And so first off, we created the exclusionary zone to make sure that people are away from our community growth boundaries and just where people live, where there's a lot of residences. And then we pushed them out so far, they started touching BLM lands and so on and so forth. And now all of a sudden they're being denied the ability to do this activity. So what we were looking at was what would be a good way to make sure we do save the public lands that we are looking for people to enjoy, such as Canocti State Park or Clear Lake State Park or Anderson Marsh State Park, or just a general destination area. And so in the definition that you see before you, we also recognize that public lands does not have a definition within the entire zoning ordinance. And so we decided to put together a definition, one that states that if it is a developed destination, such as a trailhead, equestrian trail, campsite, I would even put in there like visitor center, a place that we want people to go to, then at that point, you would have the 1,000-foot setback. But if it's not, and it just happens to be a tree and it's far away from any destination that we're looking to get the public to go to, then at this point, you would drop down to the default, which is a 100-foot setback from the property line, just as any other property that you would have. So that is the definition that's before you, and I know that we got some public comment on this as well that you can see within the attachments. We definitely have folks here in the room as well that would like to discuss this, and looking forward to the discussion from the board.
Thank you, Supervisor Sabatier. Thank you for that introduction to this item. Do we have any questions from the board at this time?
And we do
Supervisor
have,
Brown?
Yeah.
So you know, I support this idea too. I think that's what happens when we just do a broad, one size fits all. And the intentions were good, you know, but I think, in fact, I think Scott's language, I was just going to ask you, but it's not my idea. It was Scott's language to create something in there that says developed public lands rather than, you know, be specific about, you know, visitor centers, trailheads, or anything like that. It would actually have to be developed in order for that setback to come in. And Scott had recommended that one in discussion I had with him, and I think that's real simple, easy solution for that.
And the general intent is to take away the nuisance to the general public, and at this point, this would definitely still take the nuisance away, since the general public does not have easy access to those areas, since the trails and every other developed areas do not lead them to those specific locations.
You know, I used to know how much property there was, but I don't know what it is anymore because they sold some of it off in order to buy Mount Canocti and some other things. But we have a ton of land, BLM land in the county that's actually landlocked. The public can't even get to it.
Yeah.
So, and as it is right now, you couldn't develop up next to it with this, but you should be able to.
Okay. Any more questions from the board? Okay, Supervisor Sabatier?
I'm wondering if Director De Leon is on here, just to maybe hear his feedback on this.
Well, I am, and thank you. Your summary was spot on. I think the language that's in the proposed ordinance does exactly what Supervisor Brown had suggested, and as you correctly pointed out, we have a number of projects that are kind of stuck in limbo right at the moment because of the previous ordinance, and this is going to allow us to be able to move forward on those. And I think it's a great compromise, and I think it's a step in the right direction. And I appreciate everyone's efforts here and Supervisor Sabatier taking this forward. So thank you.
Excellent. Thank you very much, Director De Leon. Yeah, I think it's a good job, everyone. Obviously, Supervisor Brown, Sabatier, and Scott is moving this forward. Establishing this industry is something we've been all at least voted on, at least the majority of us. And, you know, there's just one more step to give business owners opportunity to develop here in Lake County. So, yeah, I think it's a good fix. So, good job. Any more comment from the board? Okay, seeing none, we'll go ahead and open it up for public comment. And I know we have folks in the boardroom, so let's start with the boardroom comments, please.
And they're coming.
Please state your first and last name and when you give public comment.
Thank you for bringing this to our attention and taking care of this, Scott De Leon and Bruno, so quickly. And I think by the sounds of it, it should be taken care of because this language was brought up and no one knew about it. And there are many gardens and potential areas that could be dealt with and could really benefit from this. So I think everything has been outlined. I will be representing the Lake County Cannabis Alliance today, saying thank you, and I'm hoping to see a unanimous push forward on this. And I think we have that. So thank you again for this. It is greatly needed. Have a good day.
Did you state your name, Lance? I apologize if I missed it.
Lance Williams.
Okay.
Thank you very much, Sam and Lance, for trying, but Sam has his way.
We got the cleanest mic in town. Used to be a shoe shine boy as a child.
Hi there, Norman Grimm, Emerald Mountain Farms. Just like to say thank you to Bruno for all the work that you've done and to everybody here that's done all this work for hopefully getting us to be able to go forward. One of my reasons for coming to Lake County was so that I could make a difference in the county through my tax dollars and hopefully change this community for better. Thank you.
Thank you.
And it appears that that will be the last of our public comment in the boardroom.
Okay, thank you very much. We'll go ahead and open it up. I don't see any hands up at this point on this item. So Jake, if we could open up the room.
Yes, I will. Oh, that's weird. I will open up the floor here.
Got some echo going on, all right?
Yeah, sorry about that. I'm not sure why that's happening.
Okay, Jake, you've opened the room, so we'll go ahead and ask for any public comment on our on this item that we're speaking at this time. If you'd like to make comment, please let us know now. This is item 7.2.
Okay, sorry about that. I think I got my issue resolved. Yeah, the floor is open. So if you'd like to make a comment, state your first and last name.
Okay, Jake, had it open for a while. Go ahead and close the room up and we will bring it back to the board there. Well, before we close it up, I know that we did have 3 public comments that came in through our new way here. And Carol, on those comments, I just had a question on those. Are we going to read those letters or?
No, that really wasn't the intention, but I wanted to bring to your attention. And they were not sent in under the e-comment. These were emailed. And so all 3 of them are attached to your agenda software from Damian Ramirez, Anthony, and looks like another one from Anthony.
Okay. Just wanted to make sure that they are part of the public record, that they did come in. Obviously, we are trying to lean towards the e-comments. We've opened that up, and please, we're looking to trying to use that feature as we move forward through this process. Supervisor Sabatier?
And just to, I guess I have a question that I don't know the answer to, and that is, will you be utilizing official, like for instance, let's say there's the National Forest has some trails. Will you be using the official National Forest trail maps to figure out like where things are located? How will we be the ones to state what is and what is not developed? Because I think I've seen some of their maps. They're very easy to overlay on top of ours. Just kind of curious as to how that would work, and kind of making it into the public record to make to kind of provide some guidance on how that would be found. And I guess I'm asking Director De Leon.
So what my thought on that is, we have expansive trail networks up in the National Forest and also on BLM land west of Lakeport. And, those areas are going to meet the definition because they're developed and they're designed and they're a destination for a particular use. There's also a pretty big boundary or fringe between a lot of those trails and the private property. And my approach would be if the improvement on the National Forest or BLM is more than 1,000 feet away from the property line, then I would not impose an additional 1,000 feet on the neighboring property. I would utilize the separation between the improvement and that property line.
So basically, the setback is from the improvement and the development, not the property line itself.
That's correct.
Okay, I'm good with that that detail.
Okay, we brought this back. Any more questions or concerns? If not, we'll be looking for action with this item.
Let me get to it. Mr. Chair, I move to approve ordinance amending Articles 27 and 68 of Chapter 21 of the Lake County Code to clarify the definition of public lands in regard to commercial cannabis cultivation.
Mr. Chair, since this is an ordinance, it's 2 readings, unfortunately, so there'll have to be the first reading. So Supervisor Sabatier, on the road to approval, absolutely. This would be a motion to waive reading of the ordinance, have it read in title only. And once that motion passes, then it would be to advance to the next available agenda on Tuesday.
So moved.
Okay. Is there a second?
Second.
Seconded by Supervisor Scott. Can you go ahead and do the roll call vote, Johanna?
Yes, Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
Yes.
and Supervisor Simon.
Yes.
Thank you.
And then another motion to advance the ordinance.
So moved. And may I offer a specific date so that it's on August 11th?
That's perfectly fine.
So moved with August 11th as the second reading.
Second.
Is there a second? Supervisor Scott seconds. There's a motion and a second to advance for the second reading, August 11th. Thank you very much, Supervisor.
Okay, Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
Yes.
and Supervisor Simon.
Yes.
Thank you.
Okay, thank you very much. Move to our next agenda item, which is item 7.3. Consideration of a resolution amending resolution number 2018118, establishing temporary alternative office hours for county offices located in and surrounding the Lake County Courthouse or alternative direction to staff. Administrative office. Go ahead, Carol.
Thank you, Mr. Chair. So as you know, for the last year and a half approximately, your board has incrementally authorized the closure of county offices in and around the courthouse on Fridays. You initially authorized that as the 6-month pilot and have continued to do so mostly in 6-month increments, but more recently in shorter increments. The Friday closures were originally granted due to high employee vacancy rates, heavy workloads, and disaster impacts. And so you last talked about this on June 23rd. And at that time, there had been a recommendation to reopen those offices on Fridays. And you decided on June 23rd that you wanted to take the time for a couple of board members to have a more comprehensive dialogue with the department heads about possible reopening. And so Chairman Simon and Supervisor Crandall did participate in a recent head meeting where that discussion was had. And based on that discussion, we're now recommending that the Friday closure pilot continue through December 31st, 2020. And the reasons for that are that the conditions that led to the pilot are still unresolved. Our vacancy rates for staffing still trends around 20% countywide. County offices are now also dealing with more complicated scheduling demands while serving the public through this pandemic. And on the horizon, we expect to be further challenged by PSPS. And given our 5-year history with disastrous wildfires, we all well know that the possibility of additional ones looms in our future in the coming months. PSPS and disaster response further tap our already limited staff resources, leaving even fewer staff in place to focus on their regular workloads. And part of the original rationale, since we have low staffing levels, was to enable the staff that are in place to get work done in an uninterrupted manner on Fridays. According to your department heads, staff in many departments have actually benefited from the closure time on Fridays, enabling the focus on those backlogs and uninterrupted time, especially for essential training. That was a strong point on the part of the department heads. So I know there are at least a few of them in the room if you have questions, but that would be our recommendation for now.
Thank you for that, bringing in Carol. And I would just report on the meeting that I did attend to talk specifically about this. I want to thank all the department heads, everyone just having a real candid conversation about where we are and as we're moving through, and ultimately always taking into consideration of obviously the service of the public. So Carol did hit on the head some of the main challenges. Obviously, is we haven't made much headway as far as filling the vacancies in open positions that are in. We're still running about the 20% vacancy rate, and that was talked about quite a bit. But also, I think one of the things that really needs to be highlighted is the opportunity for training and other things that they've been able to do during these hours. I know that the conversation came up, all right, well, how does it go if there's a need for a meeting? Does that happen? And multiple departments were able to expand on setting up, meetings that were on Friday and other things, whether it's virtual or by phone calls or things to happen. It is a challenge, but I just want to thank all departments, department heads to really look to always be serving the public as much as possible. I think during this COVID-19 and other issues, I know before it hit, we were discussing about coming back, but I think it's a real opportunity for us to support the workforce through this process and, ultimately educate our community as we move through with this. So I appreciated the time that was spent by the department heads, the long discussions that we had over the issues, both pros and cons with this, and I support the presentation made by admin just by echoing what the department heads kind of relayed to myself, and I'll let Supervisor Crandall talk about the other board member that was in the meeting.
Yes, I was glad to be able to fill in during that time frame. A lot of this was discussed in that meeting, and it gave me a better view as to what the department heads were struggling with. Of course, I already knew that. Of course, we came into this pandemic with some issues in that aspect. So it was just really good to have a good sit down with them and hear why they were in favor of this pilot to continue.
Okay. Do any other board members have any questions or comments at this point? Yeah, Supervisor Brown.
So, I respect the need for this, but I got to say, this thing's been going on forever, and I always joke about there's nothing more permanent than a temporary program, and this is a good example of that. I know every department can justify closing for 1 day a week for their purposes, but there's a lot of thought put into this, but it's rationalization, and it's to the end to meet a need, or to the means to the end. And there's never going to come a time, I don't think, that a department head is going to say, you know what, we're good, now let's open back up. It is convenient. It works for them, but it's very inconvenient for the public. And I'm not saying that it's not a good idea. I'm just saying, at what threshold do we say this department, Carol, you mentioned that we're at a county-wide average of 20%. That's the first time I've heard that being a criteria. I thought it was per department, depending upon, you could have one that's completely staffed and someone else who's a bigger department, lower than or greater than 20% vacancy, and so that makes the department that's totally staffed with 4 people eligible for closure on Friday. And I don't think that was ever the intention of this. And granted, maybe the loan man out, and in 6 months when this thing's over with, or January, the end of January, it's not gonna make any difference for me anyway. But I think that if we're going to do it, I think we just need to be honest with ourselves and admit that this is the way it's going to be forever, instead of coming back every 6 months and talking about what the looming possibility of a fire, the looming possibility of PSPS. If we're going to close down offices over the looming possibility of something, then let's close them down. Let's just admit it, because there's always that possibility. And I think we need to be honest with the public at some point on this. So I'm not saying that it's not a good idea for some departments. I don't know why it's all of a sudden a good idea for all of them. And we're going on an average vacancy rate as opposed to individual departments.
Thank you, Supervisor Brown. Supervisor Spatier.
Thank you very much. I appreciate the time put into this, but I will respectfully disagree as well. I think that our primary reason for being here is to serve the public, and to decrease our service to the public by 20% as far as them coming to us with their needs is not something that we need to keep going with. And I get it that even the standard bureaucratic process of processing paperwork and so on is a necessary part of the job, but the customer service to me is the priority. And I will put this on us, myself included as a board, that we have failed to change that 20% vacancy rate. We have changed to find creative ways so that they can get more work done with the same amount of staff that they have. And I think that that is part of our economic development conversation we're having, that we need to figure out how to do more without asking for more. I think that we still are using, for goodness sakes, we're still using an AS400 server. That's like a 1980s type of server. And it's just, we still have some old technology, and we still have some old processes that I think need to be reviewed and upgraded in a much more 21st century style. And I think that's where we can really find ways to help our staff get more done without asking them to do more for us. So I'm going to put this on us. Our job is to serve the public, and we're telling the public 20% of the time we're going to turn off our phones and we can't serve you. And I just can't agree with that. We need to find ways to make that happen.
Supervisor Scott.
I have to agree with the fact that the vacancy rate and the situation that we find ourselves in is definitely on the 5 of us. Looking back in March, I really saw a path forward to be able to fix some of these situations that we're looking at, trying to bring in better wages to keep our employees in place. And when COVID came, it just all fell apart. So I think for now, this is the direction that we need to go with Friday closures. But Bruno's right. It's on us. We need to figure out how we can bring those items back to be able to give our staff what they deserve to be paid, and try to keep our staff in place so we have the staff to be open on Fridays. And this shouldn't be a long-term thing. This, I know COVID's really put a wrench in things, but we need to try to figure out how to make this work. But I agree that for now, this is what we need to be doing.
Thank you, Supervisor Scott. Okay, at this point, we're going to go ahead and open it up. I know, let's start with, if we have any, well, let's just go open comment, and then if we have any department heads at this time, we'll go ahead and go with public comment. Let's open it up to public comment. I see we have a hand up here. We have a Mary Benson.
Can you hear me okay?
Yes.
Great, thank you. I appreciate you bringing it back up and for us to get some warning and time to be able to speak. I feel like we're going backward here. I feel like you had several weeks to do catch up when everything was closed down and the public couldn't come in at all, and we were shut out for several weeks. So it's hard for me to believe that there's still such an incredible backlog that you can't accommodate us for 5 days. I also feel like you're increasing the danger to all of us members of the public, because now we have the same number of people who need to come into the courthouse, but we have to squeeze in on 4 days instead of 5, increasing the chance for more contact, closer contact with one another. And I think that this doesn't help us at all by leaving us closed 20% of the time. I also hear what you're saying about the budget issues, and I feel like you're leaving money on the table by being closed on Fridays at the recorder's office so that we can't close transactions, and you're missing out on 3 days of supplemental taxes that you could get faster if you would just open up for a few hours on Fridays to the title companies at least. I've heard Richard Ford say that he couldn't open up because the courthouse was closed and the security wasn't going to be there, but the courts are the courts are open on Fridays. There's no reason why we can't come in on Fridays because security is there, even though they're there for the courts and not the general departments. The other thing is that Richard Ford has said that he feels like if he opens up to the title companies, then he needs to open up to the general public. And I would posit that he's actually addressing the needs of the general public by opening up to the title companies, because then he's allowing movers to work over the weekend, landscapers to get started, painters to get started, repair people to get started, people to move into their homes several days earlier. And I think it's better for our economy if we don't shut down for 20% of the time. So you're causing real pain to people who can't move over the weekend. They're stuck homeless because they close on a Thursday on selling their house and they can't move in until Monday. And it's a real problem. And you've heard this from us before. And I think it's time that you actually just bite the bullet and say, you know what, we're going to have fires, we're going to have power outages. Even when you have a power outage on Tuesday, Wednesday, and Thursday, you still refuse to open on Fridays when you've already been closed for 3 days. So it's really putting a crimp in real people's lives. So please, if you have to continue onward with Friday closures, at least in the recorder's office, can we allow the title companies to come in and at least close transactions, because that benefits so many people in the general public. Thank you.
Thank you, Mary. I don't know if Richard Ford is our assessor, if he's on at this point.
I'm attempting to reach him, Mr. Chair.
Okay. But we'll continue on with public comment. That was the only hand that I've seen up on this item. Jake, you can correct me if I'm wrong on that, but I think that was the only one that was up in the room.
Yes, it looked like that was the only hand.
Okay, so we have, I see Jan Coppinger. Go ahead, Jan.
Thank you. I've spoke on this before and you guys know where I stand, so I don't want to sound like a broken record. But I agree with some parts of what Mary was just saying. In special districts, even though we are not open to the public, we have never, ever not met with somebody that needed to meet on a Friday. If they call us and that's the best time, or somebody has something that comes up, we are here, we have windows, we can see when people need us, and we take care of business, because Mary's right, we're here to serve the public, and that's what we do, and to the best of our ability. But I do want to say, during the SIP, when people think maybe we had all this downtime and we're able to get caught up, most of our employees were sheltering in place. They were not here getting caught up. We are less caught up now than we were when we started the Friday closures, and for good reason. And I just want to say, I agree that we need to find ways, something like title companies, that's critical. When you're closing on a house, get it done and find ways to make that work. There's a variety of ways we found that we can meet the public's needs on Friday and not have to turn them away or have them wait till Monday for something important. And maybe that's what we need to do, is get a little more creative about that. But I just wanted to clarify those 2 points that Mary had made, that we should be all caught up because we didn't have anything to do for a couple months while we were sheltering in place. But fact is, I think a lot of departments, mine included, slipped even further behind during that time. Thank you.
Thank you, Jan.
So far, Mr. Chair, I'm not hearing from Richard Ford. If Chair, I believe he would explain some of the workarounds his department has done, but I regret that I'm not able to speak to that.
I do know this issue was brought up when these first started. If he was here to answer, I definitely don't want to speak for him either. Okay, let's go to the boardroom. Do we have any individuals in the boardroom who would like to make public comment on this item?
It does not appear that anybody will be making a public comment.
Okay. All right, we'll go ahead and close the public comment at this point, and we'll bring it back to the board for our discussion or action. And we'll obviously carry forward the questions or concerns of the title companies to Mr. Ford. So, all right, Supervisor Sabatier.
So my thought process is we re-review this periodically, but yet, and I know that we're trying to do what we need to do to progress in so many different parts of our agency as a county to serve the public, but I can't recall any specific thing that would be brought to the board saying we're bringing this in order to increase in efficiencies to help reopen on Fridays. And I think we need to have a better focus on that, because we can't forget that this is here, that this does reduce access to the public to us, and that we need to work towards that. And so maybe if there is something that directly relates to that, we need to say so, that this is in an attempt to try and increase efficiency so we can reopen on Fridays. But I just haven't seen any, at least from my perspective, I have not seen the meeting of the minds to say, how do we solve this versus it coming back to us every 3 or 6 months. And I think we should be a little bit more proactive about it rather than obviously waiting for what seems to be the same result each time so far. And maybe I'll be surprised on the next iteration, but I think that we need to be more proactive about making that change.
Okay. Thank you for those suggestions, Supervisor Sabatier. And, as we work through this situation, I completely agree. More focused approach, and we'll look to attempt to bring something back that hopefully will maybe be able to make some different decisions down the road here as far as this issue goes. Supervisor Crandall?
Yeah, I was just looking at on where it says now therefore be it resolved, where it says every day except Fridays, Saturdays, Sundays, and holidays. Is there a way that possibly, if we move forward with this, we could make it to where the Friday where it lands on the same holiday week? So for example, let's say that Labor Day is on a Monday, and that Friday would be open rather than closing that Friday as well. So it turns into 3 days less access to the public, or 3 days access to the public. I'm just looking at other alternatives to kind of work back to it, if that makes any sense. to opening Fridays, because eventually we're going to get there, or either that or we're there. I don't know, but I'm just trying to offer solutions. That's all.
Yes, that would definitely be doable. And there would be, if you think about the time period proposed now, there would be at least a few of those Monday holidays coming up. There would be Labor Day, Columbus Day, Thanksgiving Friday. Those are the ones that come to mind. So there would be several of those at least.
And I believe that was changed to Indigenous Peoples Day.
Yeah. I'm pretty sure it was changed to Indigenous Peoples Day too. Thank you.
Sorry about that. Sorry about that.
Okay, it sounds like
We could
that
add
is
language,
something-
we could add language into the paragraph the supervisor just referenced that could say something like, unless said days precedes a paid county holiday.
Okay. Supervisor Sabatier?
I actually really like what Supervisor Crandall just brought up, and maybe just saying that we will be open 4 days a week, and not necessarily say Monday through Thursday, and then maybe specifically set out and say except for Thanksgiving week and except for the winter holiday. And so I think that that way it can be flexible and we can move it around depending on if it's Friday holiday or Monday holiday, so that we are still open 4 days a week. I like the idea. I don't know how that looks in writing, but I appreciate Supervisor Crandall for bringing that up.
Okay. Supervisor Scott?
I think if we're going to do that, we have to surely make sure that we have this posted way in advance so the public is aware of the days that we'll be open and closed, because I think doing that may cause some confusion.
Okay. It sounds like it can be an easy fix in writing it out, and you're right, correct. We need to get that out there and communicate with the community as much as possible. But what we're attempting to do, obviously, is move forward with the resolution, or at least that is the proposal today. And with those changes that were suggested, whether it's 4 days or the way that Supervisor Crandall put it, the holidays, I think it can be achieved. So if we could just come to agreement on that, then we could, if anyone's interested in offering the resolution, we could move forward.
I'll offer the resolution as amended.
Okay.
I'm sorry, Mr. Chair, what will be the amendment then, just for clarity in the motion?
So
my vision of the amendment, and I thought I would work with you to make sure we have the tightest language possible, is that we would let it, we're talking about the paragraph that immediately follows, now therefore be it resolved. Let that as is, but add an additional phrase that says, unless the Friday precedes a paid county holiday on the following Monday, something to that effect.
So unless it's any week that contains a paid county holiday.
Yes, that's a better way.
That's all I needed, Mr. Chair, just so the public knows now what you're thinking.
Okay. Supervisor Sabatier?
I'm just curious, since this might be a change in working conditions, does this approval get brought to the union, or I guess I kind of feel like we're negotiating in public?
Yes, we always review this sort of thing with the union.
Does that answer your question, Supervisor Sabatier?
Well, I take it that Ms. Grant would let us know if we were doing it in the wrong way, but I appreciate to know that this will be going to the union since it does have some impact.
Well, in that case, the resolution should be offered but contingent upon further discussion with the bargaining unit.
So this is, I don't believe this requires meet and confer, because the rules around schedule change require 5-day notice. This, no change here would occur until we get to Labor Day. And so the notice requirement to staff would be met well in advance of that. But nonetheless, as a courtesy, we would definitely call this to the attention of our union.
Well, right, but that's an informational, but if you do that first generally, I'm not real clear on why there'd even have to be a 5-day notice since no one's shift is changing. I mean, they're still gonna be working.
Yes.
It was just whether they were working behind closed doors, so.
Yeah. This is really a courtesy notice.
Right.
Okay, well.
Thank you for the clarification. Yeah, it's not a difference in work conditions. It's just a difference of if your door is locked or not.
Okay. So Supervisor Crandall, with clarification, has offered the resolution. So can we take a roll call vote?
Yes. Supervisor Sabatier?
No.
Supervisor Crandall?
Yes.
Supervisor Scott? Supervisor Scott?
Did we lose Supervisor Scott?
You probably ought to wait for her because you might need her.
Does look like she is dropped from the Zoom meeting.
Contact her. So, Mr. Chair, I hopefully I'll hear from her momentarily. You may want to put a hold on this and continue with 7.4 until she gets back, since 7.4 involves a different district. And hopefully we'll hear from her momentarily.
Okay, just protocol on that. We've never lost anybody like this in the middle of the vote. So Anita, I think just clarification for me. We'll move on to 7.4 and then we'll leave this item open on the vote and come back to it. Just a question on clarification on that for procedure wise.
Yes, sir, you can leave it open right now. If you go to a 2-2 vote, it would be no action, so you can just simply continue it.
All right, we're going to go ahead and continue it, see if we can get Supervisor Scott back on. We'll address item 7.4. If she's not on at that point, then we'll go ahead and move forward so we can get finished up here. Item 7.4 is consideration of the following appointment for the Cobb Municipal Advisory Council. And we have two folks. We have
no, there's only
Elliot
one.
Horowitz, Elliot Horowitz has resigned, and we have Christian D. Nettles to be appointed. So go ahead, Supervisor Brown.
Well, you want to ask for public input or board input first? Or?
Yeah, any board input?
I'm good.
Okay, seeing no comments from the board, we'll go ahead and open it up for public comment. I don't see any hands up. Jake, can you open up the room?
Yes, I will open up the room here. The room is unmuted. If you would like to make a comment, please say your first and last name.
Just letting you know, Supervisor Scott's calling in. She got kicked off the internet.
Oh, there it is. Perfect.
Okay, we're doing public comment. We're doing public comment on item 7.4.
Yes, it's Jessica Paiska from the Cobb Area Council, and the group, we met at the end of last month and nominated Chris Nettles to take Elliot Horowitz's place on the board. So I hope you approve. Thank you. Thank you,
Jessica. Okay, we'll go ahead and close up the public comment. Close the room up, Jake, and we'll bring it back to the boardroom. Do we have any constituents in the boardroom who'd like to make comment?
I do not believe there is any comments in the boardroom.
Okay, we'll go ahead and close public comment at this point and bring it back to the board. Go ahead, Supervisor Brown.
I move to appoint Christopher Nettles to the Cobb Area Council to replace Elliot Horowitz. And I'd like to thank Elliot for the immeasurable amount of time that he spent in the inception of this the Cobb Area Council and his hard work throughout it. The grant fund, I mean, the guy really put his heart into this, and it's more than just a committee assignment that was made. He really made a difference up there. I think Jessica would agree with that as well, and I can't let his resignation go without saying how much we appreciate how much he's done.
Second.
Okay, motion and a second. Motion and a second by Supervisor Sabatier. Go ahead and let's do the roll call vote. Johanna?
Okay, Supervisor Sabatier,
Aye.
Supervisor Crandall,
Yes.
Supervisor Scott. She might be muted. I'll just keep going. Supervisor Brown
Yes.
and Supervisor Simon.
Yes.
Thank you.
Aye.
Okay, thanks.
Okay, there you go. Thank you, Tina. All right, we're going to go ahead and return to item 7.3.
Hurry while you still
At this
got her.
point, what's that, Rob?
I said hurry while you still got her on.
So item 7.3, we are in the middle of the vote. I would go ahead and start again. We'll just start with the vote again, if that's all right, Johanna.
Okay, Supervisor Sabatier,
I'm sorry, I was distracted.
Item 7
for the hours.
Item 7.3. You voted no.
No.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Brown,
No.
and Supervisor Simon.
Yes.
Thank you.
Okay, we'll go to our 7.1 item, Supervisors' Weekly Calendars, Travel and Reports. We'll start with Supervisor Crandall.
Yeah, so tomorrow I have the CSEIU wanted to meet with me or invite me to something they were having, so I'll be on a Zoom meeting with them. In the evening, I'll have a CSA number 2 meeting. I haven't got notification of my town hall on the earth. I'm not sure that they're having one still. Friday, the Blue Collar Committee 10. Let's see, on Monday, let's see, that's it. COVID recovery, and then a meeting with Carol in the afternoon back here on Tuesday.
Okay, Supervisor Sabatier.
By the way, that's why I was distracted. I was getting my calendar out to be prepared, just so everyone's aware. So the rest of the day, I'm going to hang out here in the office and go upstairs and speak to some directors just to check in and see how things are going. Tomorrow, I have an APC LTA meeting with Supervisor Simon as well. I have actually 2 CSAC conferences in the afternoon. The last one will be interesting. It will be regarding distance learning and the digital divide, and hopefully I'll be able to gain some insight on maybe where we can get some funding for our schools to help them make sure all their kids have access to the internet. On Thursday morning, it'll start out with an EOC phone call for an update on COVID-19, and we'll continue to work on my little pet project I got going right now. That I hope to deliver soon, within maybe a month or 2. Later on, have another CSAC call with the state, just to check in on what's going on at the state level. As I spoke earlier, when Dr. Pace gave us the update, I keep checking in to see when we're getting if we're going to get our Verily site contract updated so that it does not expire on August 31st. I think that's an important part of our process that we have here, and we need to keep that going. Later on that evening, 6 p.m., the City Council of Clear Lake will be meeting, so I will be joining them on Zoom. And then it looks like the rest of my week is pretty open up until Monday, where I'll be back here and preparing for our meeting on Tuesday, another CSAC call to check in with the state and see where we are with COVID-19 as well, and meeting with our CAO, Carol Hutchinson. I did want to, just for informational purposes, especially this is, we're all starting to think about, and it's already we're past the date when they started last year, but the potential for PSPS. And I think that people, yes, there are changes that are happening, but we need to be prepared for exactly what happened last year, just in case. But one of those ways you can prepare is look into the SGIP program, and that's SGIP. It's self-generating, what does the I stand for? I forget. I and then program. And basically, sorry, I forgot what the I stands for. Basically, you have the ability through PG&E, we have been dedicated on the map because we've had more than 2 PSPSs last year. So you don't have to meet any other criteria right now. You need to look for that SGIP program through PG&E, and you will maybe be able to afford an entire battery backup for your house. That battery backup does not need solar panels. It can be directly attached to your electricity so that it can charge it up. It's ready to go so that if the power goes down, you can rely on that battery backup. Now, of course, the amount that they're going to refund you on the battery is going to be different on different people in different situations, but the fact is there is a whole lot of money out there ready to help pay us back so that we can reduce the impact of PSPS. Again, it's
Incentive.
Thank you very much. It's the self-generating incentive program. Look it up.
Yep.
It's through PG&E. They have an application, and the folks installing your battery are most likely going to do the application for you. And so please look into that, because any way that we can reduce our impact from PSPS is going to greatly benefit all of us. And I would say businesses as well as residents, please look into that.
Thank you, Supervisor. Supervisor Scott?
Yes, tomorrow I'll be spending the day taking my son down to get his wisdom teeth pulled, but I'll be available by phone if anybody needs to get a hold of me or email. My phone number is 849-4414. On Thursday, I have a meeting with the Hope Rising. We're discussing a narrative story for Lake County. I have a 1:30 department head meeting and 3 o'clock COC. On Friday, we'll be preparing to take my daughter to college for the weekend, and then on Monday back here with the Hope Rising meeting at 8:30, and then meeting with constituents later that day, and then back here on Tuesday.
Thank you very much, Supervisor Scott. Supervisor Brown?
So before I get into my calendar, Carol, is there a way that that we could agendize a presentation from PG&E to show what they've done? I think there's a misconception that from now on PSPS is going to be the way it always has been. And I know they've done a lot of work to isolate areas away from PSPS. They've set up generators. They've set up, they've done a lot of work throughout the county in order to keep things running in a lot of the county, the heavier populated areas. And maybe we should allow them the opportunity to come speak to that to the board, because it's, we're making a lot of decisions based on what might happen during a PSPS, and I think we need to better understand what PSPS today looks like as opposed to last year.
Absolutely, you can certainly ask. Do our board members that are on the PSPS committee have thoughts about that?
Yeah, I definitely do. I know that there are some critical dates that PG&E is definitely working on, Rob. I think one of the ones was September 1. Obviously, they are doing a lot of work right now. Yeah. And I know they were looking to roll out some information here coming up pretty soon. So I don't think it's a bad idea. I just think that we need to reach out and make sure that the information is, kind of the work done completed and other things with PG&E. But I definitely think that's something that we could do to reach out to them and ask for a report given at the BOS meeting.
Yeah, I think, and I know what it is because I've been in contact with them, but I think the public needs to know, and I think a lot of our own employees we're talking about, we're making decisions based on that, and they have done a lot already, and they're going to continue to do more, but I think it's not too soon for them to come and give a report on everything they've done, what their plan is, and give us a better idea of what that would look like if a PSPS was to happen today, exactly who they anticipate it to be impacting and not. So I appreciate that.
Supervisor Sabatier?
I know that I talked to the chair of the PSPS committee because we had discussed about doing a town hall and letting PG&E take the lead in the information they provided rather than us paraphrasing. I know that when I spoke with the chair, I was told that PG&E is organizing informational town hall, but at the same time, I think that the more we repeat it, the more likely people will hear and understand better how that will work out. So I would say that yes, they're going to do something, but yes, we should also invite them to the Board of Supervisors because we have a lot of people signing in and listening these days, especially through Zoom. So it would be a good opportunity.
Excellent.
So on my calendar, if I'll just continue, it's pretty easy. It's not, I don't have a whole lot going on, but I do have a couple of things, meeting with a couple of constituents that are interested in what's going on with their business with COVID. And then on Friday, we have the Blue Collar Committee meeting by Zoom. And I don't have it on my calendar yet. I don't think you've sent us an invitation yet, Carol, but we do have the CARES Act review on Monday.
That's correct. Monday at
2:30? 1 o'clock?
Okay. All right, that's it.
Okay. All right, so appreciate the conversation and Supervisor Brown bringing up the PG&E presentation and Supervisor Sabatier talking about the SCHIP program. I think both positive things. And just one more message, you know, we're rolling into fire season here. I know we've done a declaration at this point from county to the utilities and everybody about vegetation abatement. And I know Supervisor Brown also did a press release just being prepared. So just want to keep reiterating that week after week. We know that we had a close fire over in Calusa and just being prepared as possible. Have a, you know, it's real interesting to say having an evacuation plan in these COVID times, but please be prepared, have a to-go bag, you know, have family coordination where you're going to meet up if things really get bad, and just pay attention to the messaging that'll be coming out from the county for sheltering, pre-screening places, and others around the county. It is going to look different, but please be prepared beforehand. Have your medications and other stuff for our senior and our disabled communities ready to go, because those are always challenges that we run into during these evacuations. As we move in next week, as Supervisor Spatier says, I have agenda review today after this meeting ends, and then I have Lake Transit Authority Area Planning Council on Wednesday. On Thursday, start with the EOC meeting in the morning. I see there is have a special department head meeting on Thursday afternoon. Friday, start again with the EOC meeting. Back here Monday on the work group. Have the EOC meeting in the morning. COVID recovery work group at 12 o'clock. And then back here for the meeting on Tuesday. There is one other thing too. I know I just want to report on. I know that SBA, there is going to be some Main Street lending opportunities that come through SBA. I think they're starting to come out this month, try and compile the information. But it is going to be a Main Street lending program for everyone in the country. You know, so we'll try and report each week when that's rolling out and opportunities for businesses. It is a loan, obviously it's not a grant, but maybe some other funds available to help our businesses. And I'll do my best to get that information out there and work with Matthew if we need to do a press release or something, just to talk about SBA loan opportunities called the Main Street lending part that we'll be rolling out from SBA. So we'll continue to report on that. As with that, that concludes our calendar today. We'll see everybody back here on the 11th. Appreciate you working through our technical difficulties for the folks that stayed here for the meeting, and we'll continue to try and refine our hybrid meetings as we move through the COVID-19 pandemic. Please be safe, and we'll see you on August 11th.